How's it going, guys? We are live right now. I'm just going to field some USMLE questions. Just a few. This will not be a lengthy USMLE Q&A. So obviously I just did one of these yesterday as well. You can drop some comments in the chat, guys. You can drop some comments in the chat if you have questions for USMLE. I'm just going to do a quick Q&A. If you're one of the first people here, then obviously I'll see your questions first, and then we can go about that way. So if you have questions as far as preparation, your scores, like anything you're concerned about, all the fucking annoying questions, all the annoying questions I hate answering that people constantly whine about. If you have those questions, drop them in the live chat here, and I'll address them, and we can just do some Q&A right here. Pediatric shelf tips. Pediatric shelf tips. And guys who just came in, give the video a like so the algorithm kicks up and more people can get here, so it gets more awareness. Pediatric shelf tips. Yes, Abelard, I can give you excellent fucking pediatric shelf tips. In fact, the first pediatric shelf tip is you're going to do all 8 pediatric CMS forms, and you're going to do them twice. Okay, so however long your peds rotation is, let's say it's 8 weeks. What you're going to do, there's 4 things you're going to do. The first thing, guys, give the video a like, please. So give the live a like so it kicks up the algorithm, brings more people here. Drop your Q&A in the chat here. So the 4 things you're going to do for pediatric shelf is, number 1, all the UWorld or AMBOSS questions. Don't have to do both Q banks. Just you're going to choose a Q bank. You're going to do all those peds questions on your shelf or on your rotation. And you're going to do all CMS forms, the 8 CMS forms, twice. Okay. So it depends how busy your rotation is. If you have a very fucking busy rotation where you're literally at the hospital all day, then you're going to do 16 days where you can only get one of those pediatric CMS forms done in a day, the 50 question forms. You have 8 days, you do all 8, then you're going to do another 8 days where you do them again. If you don't have a busy rotation, obviously you can do like 2 forms on a day. So you can get all double pass of all 8 forms done across 8 days. Okay, 2 per day. So I said 4 things. So QBank, number 1. Number 2, all the PEDS forms, CMS forms twice. Number 3, you're going to do my PEDS PDF, which is fucking ace. Okay, under my free stuff tab on the website, obviously. And then number 4, you're going to do my YouTube playlist for pediatrics. Okay, so obviously the MCQs I put out, if you just go into my YouTube playlist, obviously, you'll see the PEDS questions there. Okay, so guys who are just joining, give this a live a like so it kicks up the algorithm and brings more people here. Really appreciate it. Nikia says, hey, my friend. Nikia, thanks for being a member of my channel, by the way. And I know that because your name is bold and green, and you've got my icon, the Mehlmanmedical icon next to your name. Everyone else's is gray. Yasmin says, how can we score 260 plus? Obviously, you're talking about step 2 because step 1 is numerical. I've inculcated the same dumb shit. Okay, so obviously, if you're trying to ace 2CK, you've got to go through all of AMBOSS or UWorld. You can do either one. They're non-superior to each other. So you can do literally all 4,000-ish questions, 4,100 in UWorld. You're going to do all 3,700-ish in AMBOSS. So you're going to finish all those questions. You're going to do all the CMS forms twice. The 50 question NBME subject specific forms, you're going to do all of them twice. Holy shit. And you're going to do NBME 6 through 13, including free 120. So obviously it depends on whether you're post-grad or whether you're on rotations, right? Because if you're on rotations, you're going to do what Abelard is doing, where you're doing per shelf. So that's like subject specific, obviously. So you knock out per rotation. But if you're a post-grad, then you can be just very linear, very clean. So you do all the fucking QBank, you finish it. You do all the CMS forms, 2 per day over 3 to 3.5 weeks. You're going to do NBME 6 through 8 offline, 2 days per NBME. Then you're going to do a double pass of all the CMS forms. Holy shit. Free 120. Then NBME's 9 through 13. That's how you're going to ace your 2CK. That's how you get 260 plus. And of course, you're going to do my PDFs, my free PDFs, right, on my website. And you're going to do my YouTube MCQs. I mean, very, very easy. Brown says, hi, what's going on? Ikra, Miriam. Can I skip UWSAs for CK? Ikra, I've never fucking said do UWSAs. Like, I've inculcated that UWSAs have no role apart from if a student has exhausted all the NBME content, right? So if you've exhausted all the NBME content, there can be a time and place for incorporating a UWSA, right? So it's not necessary. And it's because we have copious CMS forms. We've got NBME 6 through 13 and free 120. So there can be a time and place, as I said. Usually, if let's say you're coming to me over the Skype, we're meeting for the first time, and you say, I've done all, the online NBMEs or something, and I would have you do the CMS forms twice. I'd have you do offline NBME 6 through 8. And let's say your scores are equivocal. Let's say they're around pass, we're not sure, then I could have you do a UWSA. So there's a time and place for that, but they're not mandatory. And for those of you studying for step 1, I've also said that UWSAs aren't mandatory anymore because you've got 20 through 31, including free 120 you're doing. It's simply that we have copious materials, so they're not a priority. Muhammad Ali Jarrah says, do you have an account in Telegram? Yes, I have a fucking account in Telegram. Underneath literally all of the videos that I've been putting out on YouTube with the MCQs, in the pinned comments, I've been writing like, here's the link to our Telegram group right now. So yes, I have an account on Telegram. Everything's stable with Telegram now. I just reiterate this. I will never fucking cold DM any of you on Telegram. Okay, that's just remember that. Like occasionally WhatsApp, I'll message students, but like Telegram, just the group, just the channel. I will never cold DM you or solicit anything like that. Emmy says, I just took my PEDS shelf exam today. It was hard. Okay, I'm sure it was. What do you want me to tell you? I'm trying to think what I did after my PEDS rotation when I was in Australia. It was funny because I was in the Asian group. Isn't that like weird? Like I was in the Asian, like I gravitated toward like, you think like in high school or something, like you're in your like niche of friends. I always hung out with the Asians. So I went out with maybe like I don't know, 7 of my Asian friends. We got Korean food. We got margaritas as well. And I remember like one of the dudes in my group, he got like, the Asian flush, like the Asian gene. He had like half his margarita and he was like hyperventilating. I was like, bro, are you like okay? It was like funny though. Raja Taha says step 2 recalls. I mean, what? I've articulated prior that like, the notion of recalls, there's no shortcuts. So if you do recall, if you never fucking pay anyone for recalls, okay? Quote unquote recalls is the NBME exam. Like, okay, so when you do the NBMEs, the CMS forms, those are recalls. Never fucking pay anyone for quote unquote recalls. That's how you get scammed. There's no shortcuts. Carson says, love you, Mike. Love you too, Ben Carson. I hope you run again for the Republican primary, even though I don't think you're going to get very far, but it's good to see you in my live chat here, Ben Carson. Find myself, Mike, I can't help but get disappointed if I score low on UWorld step 2. Guys who are here, I really appreciate you joining. Why don't you give the live a like so we can kick up the algorithm and it will bring more people here. Find myself username. You said, Mike, I can't help but get disappointed if I score low on UWorld step 2 and give up studying for the day. I know you said we shouldn't give a fuck. Is there any way to avoid this? The answer is you can't get emotional. I've said this a lot. Like studying for the USMLE is also a psychological screening test where you're not just learning information for obviously your medical career and doing well in the board exams, but it's a psychological screening mechanism where you can't be perturbed by micro fluctuations in your scores. Okay. So the same fucking way, I analogized this yesterday. The same fucking way, if you're like in the middle of a surgery, you're performing surgery and there's like some external stimulus that like, annoys you or something, like you can't let it affect you. You got to be agnostic. Okay. You can't be labile. So if you're watching this right now, okay, you guys, you're going through UWorld and your scores aren't where you want them to be. And you're like, well, what do I do? You have to just like unemotionally, day by day, just knock out UWorld. Okay. So whether you're getting 36% or whether you're getting like, 82%, you just got to knock out the QBank. And I've said that the mornings you're going to do untimed tutor random mode. Okay. And then, you're going to have your lunch, and then the afternoon/evening, you're going to do your subject specific, like take one of my PDFs, let's say biochemistry, and then you can also do biochemistry YouTube MCQs. So that's how you're going to knock out my QBank, right? The YouTube MCQs with a PDF, that's your quote unquote subject specific. So if you're on like, let's say, you got a renal quiz in school in 2 weeks, you can knock out the renal PDF with the renal YouTube playlist, like in the afternoon, evening, but the QBank, you're still doing random untimed tutor. Okay. So If you're in a situation where you're failing school, your school is going to say, fuck you, we're going to dismiss you. If you fail, okay, it's a dire situation. I can occasionally have students do subject specific for QBank rather than untimed tutor random, but I prefer untimed tutor random because that's going to maximize your macro retention. So, but to the consolidator on that point, find myself, as I've articulated repeatedly, you can't get emotional about things. Dina deleted your question. Okay, Dina, there's no problem. You can delete your question, but I mean, we're just you had a chance right there. Nishad M says good percentage on the first pass of CMS. Question mark. I'd say 40 out of 50. So the CMS forms, the subject NVMe subject specific forms 2CK. You want to get probably, I'd say, bare fucking minimum 35 to pass, 35 out of 50. The same way when students, those of you watching this, you ask me like, what's the pass for step 1 or what's the pass for 2CK for like what percentage should I get in the NVMEs? I say I'd like to see mid 60s plus, right? So, I mean, we could probably just translate that over to the CMS forms. We want to get 35 out of 50, 2/3 plus ballpark. That's what I like to see. If you get in the 20s, I'm not happy with that, clearly. So Brown says, I am 5 point, I don't know, am I like dyslexic or something? I am 2.5 months away from my exam. Brown, are you studying for step 1 or step 2? If you said up further in the chat, you think I'm like remembering which exam you're studying for. You're 2.5 months out, you have 51% New World. How do I proceed? So whether for those of you studying for step 1 and step 2, I'll address both. And it's actually the same fucking answer I just gave, which is if you're only 50% done with UWorld, you got to just proceed through the QBank. I don't want you guys touching NVMEs unless you've finished UWorld. Okay, like there of course can be a time and place for doing an NVMe prior to finishing QBank, but I don't want you doing that. I want you just going through the entirety of the QBank. I don't worry about your scores. Okay, so like when I have students over the Skype and like they say, "Oh, I'm getting like X in my blocks in UWorld, what should I do?" I'm like, "I don't give a fuck." That's literally like what I say to them. I'm just like, "I don't give a fuck." Like, I just want you getting through QBank. Like, make progress through QBank. Okay, and then when we get to the actual NVMe content, that's when we'll worry, quote unquote, about you and your actual objective percentages. Rami says, "Hello, I'm studying for my pulmonary NVMe exam soon. Do you have any tips on how to score high, like practice?" Oh, absolutely. Pulmonary, guys, have you done the high yield pulmonary PDF that I updated? It's fucking ace. Okay, so you're going to want to do that PDF. There's lots of tables in there. Excellent PDF. Okay, excellent. So yeah, you'll do very well on pulmonary if you go through my high yield pulmonary PDF. And also, I mean, this sounds like common sense, but it's good advice. You'll be like, yeah, you're right, Michael. That's a good idea. Go through my high yield cardio PDF as well, because aren't cardio and pulm adjoined, right? In terms of their like relevance to each other, right? So you understand cor pulmonale, you understand left, right heart failure, you understand, the different murmurs and stuff, right? Like pulmonary hypertension could cause a loud P2, can cause tricuspid regurg. I've mentioned that repeatedly. I mean, so there's a lot we can chat about. So, but go through my pulmonary PDF obviously as priority. Go through my cardio PDF secondarily, and then go through the YouTube MCQ playlist that I have, right? So do pulmonary playlist, do cardio playlist. Ali Harvey says, when do we use NSAID or acetaminophen osteoarthritis? It's annoying on the NVMe. Guys, USMLE wants acetaminophen first line for osteoarthritis, okay? It's non-inflammatory, so NSAIDs aren't going to work any better than acetaminophen will. That's the thing, and we don't want to kill the kidneys. So people who have degenerative joint disease, OA, if they self-medicate, they like this in family medicine. They'll tell you like a patient, 60-year-old woman who's been self-medicating with high doses of naproxen for the past 6 weeks with her OA. And some students are reading that. They're like, "Oh, it says naproxen though, not acetaminophen." I'm like, exactly. That's the fucking point for family medicine. Is like the patient is erroneously, okay, they're using the wrong medication. You shouldn't be using NSAIDs for that reason. And the vignette will have the patient has peripheral edema, and the answer is going to be interstitial nephropathy. Okay, so or discontinue the naproxen. It's not hard, and it can also be increased renal retention of sodium. That's another answer for NSAIDs affecting the kidney. But you're going to give acetaminophen first for OA. Um, and intra-articular steroid injection is a rare answer, but it shows up once on one of the new 2CK NBMEs, which is very fucking weird because clearly OA is non-inflammatory, so it's like a placebo effect. But if the literature does confirm that it's an answer, it can be. But the question, I believe, on the 2CK, they said something like there was a problem with like a patient had like GI bleeding or something, and like all the answers like acetaminophen didn't work, and like GI bleeding, and you're like, well, there's no NSAID that we're going to give, and then answer was like intraarticular steroid injection. Let me see. Where was I reading this? Sometimes when you guys post, it like moves the fucking chat on me. Let me see. All right. Abhin Shah says, thanks for all the help, Mike. School has, guys, if you're just joining the chat, please give the live a like so it'll kick up the algorithm and bring more people here. So Abhin Shah says, thanks for all the help, Mike. School has us taking step 1, step 2 back to back. Any tips? Yeah, I want you taking at least ideally 4 months for step 2 prep. I don't know what your school's forcing you to do in terms of, when you say back to back, like how much time does that necessarily entail, right? So, but I'd like you, obviously, when you finish step 1, like take like up to a week off. You've got to be able to kick back a little bit just for the sake of burnout. But I want you doing 4 months ballpark for 2CK prep because you're going to have to get through all of the QBank, Amboss, or UWorld. You're going to get through all the CMS forms twice. You're going to get through NBME 6 through 13 and free 120. So I'd say ballpark 4 months. But if you're talking about like they're making you sit back to back like within a month, that's a bad fucking idea because obviously you need to ace 2CK. So we got to make sure that you are able to do well on that. Mo asks, hey, Mike, hope you're doing great. I've been preparing for step 1 since last November, which is taking forever. Do you think UWorld plus NBMEs alone are enough to grasp? No. I mean, like I've said, do the tetrad of you're going to do QBank, NBMEs, my PDFs, my YouTube MCQs. Obviously, there's going to be those of you who are good test takers, but I think that you need to do those 4 resources, okay? Not just UWorld and the NBMEs. Abelard Desroisier says, thank you very much. Double S says, how to know when I'm ready for step 1. The NBME exams will objectively tell you if you're ready for step 1. So clearly you're going to get a score on the NBMEs. That's not anyone's opinion. It's not subjective. So do the NBME exams 20 through 31 and get your 3-digit score conversions. I said that you're going to get a number of wrong on each of those exams. You're going to take that number. You're going to type into Google Images, actually, not Google Images. You're going to type in NBME 20 score conversion Reddit, NBME 21 score conversion Reddit, and you're going to get a graph. It's going to show you like X will be the number of wrongs, and then Y will be the 3-digit score conversion. 197, obviously, the internal pass mark for step 1. And then I like seeing 205, 210 plus as a buffer, right? So if you're getting your 3-digit score conversion, it's like a 199. I consider that a YOLO. I don't want you YOLOing into the exam. I don't want it to be where we're like, let's go for it. Let's just fucking do it. I don't want that. I want it to be 205, 210 plus comfortable buffer on at least 3 NBME exams. I've articulated that repeatedly. So that's how you'll know when you're ready for step 1. I don't have students who fail step 1 or fail the steps anymore, in the sense that I am like hyper fucking conservative as far as like, I know I want a big buffer between like, if 214 is pass mark for 2CK, I'm like, my students, I'm like, you're gonna have multiple NBMEs 220 plus. Student gets a 217, I'm like, I don't want you sitting. Student wants to fucking sit, like it's a discharge against medical advice kind of thing, where like if the school says fuck you, you have to sit, and students like, it's not in my control. I'm like, look, I'm letting you know I don't want you to sit right now, but if you're forced to sit, you're going to sit. So because the reason is it's not subjective, it's objective. The NBMEs don't fucking lie. If you get like, you're doing all the NBMEs in the final month, as I've said to do for steps 1 and 2. So if let's say 30 students, I arbitrarily use this figure. If you take 30 students, you sit all the exams, and maybe 25 out of 30 are gonna score around the average of their NBMEs. Maybe 3 out of 30, so 1 in 10 students will score higher than their NBMEs. Okay, you're scoring like in the 230s, and then you get like a 246, and you're like excited, and you're like, Mike, you're the best. I wouldn't have done this without you. And I'm like, cool, but it's not really me. It's just coincidental. You bumped up. I'm happy though. And then maybe 2 out of 30 get like lower than their NBMEs or like the lowest NBME. So let's say you had like, you sit 20 through 31 and like, of course, yes, it's pass fail, but let's say you're averaging like, you know, I shouldn't, obviously it's just a pass fail, but let's say we're talking about step 2 then, right? So if you're getting like 226 to like 251 and you go in there like hoping for that 250 and then you get like a 228 and you're all depressed, that can happen like, 1 out of 15 times. But you got to be mindful that like the NBMEs don't fucking lie. And like you can't erase the fact that like you truly got a certain score on one of the NBME exams. We can't ignore that. It might not be convenient, but that's just how it works, right? Like, because, depending on which cubicle you sit in, depending on like literally whether you take the exam a day earlier or later, it's coincidental. It's a toss up as to which form you're going to get. So we don't know. So you got to be prepared to get from the bottom to top of the spectrum of the practice scores you have. Mustafa says, what's your advice for IMGs with a lot of shitty college exams that are away from USMLE content? So I don't know what that's referring to. That are away. Oh, college exams that are away from USMLE content. When you say college, that means like undergrad, just so you know. So, but if you mean like those of you with like med school exams that are like have no relevance to USMLE, that's like most schools. That's not like even like US schools. That's how it is. Like that's not unique to IMGs, by the way. Like USMLE, prepping for USMLE is literally like I shouldn't say disparate, but it's the degree of overlap is like fairly insignificant with like school medicine forms and slash assessments at most institutions. You're studying for like parallel curricula where they get in the way of each other. Everyone here would score higher on the USMLE if rather than dealing with schools' onerous bullshit requirements, you could sit in an apartment in Iceland and just like do questions all day, never attend med school, and you would score better than being physically in med school and dealing with their shit. That's like that's a known fucking thing. So Mara All says, what to do the day before the step 1? I've said you're gonna take a chill day. You're not gonna study for step 1 or step 2. Those of you, the day before your step, you're not gonna study past like 2-3 p.m. I don't want it to be like a busy study day. We don't want that. So, if 2 extra hours, 3 extra hours of study the day before your USMLE you feel is going to make or break you, if your knowledge grasp is that tenuous where it matters to that degree, you're not ready to sit. Okay. So it's not going to matter. Trust me. The important things the day before that you're well rested. Okay. You just get good sleep. And number 2, that, you just reviewed everything very well up until that day because you've studied hard, right? So you're well rested and you just like keep a low stress level. You watch a movie like the night before, have a light dinner, like that's what matters. So let's see what else the day before. Yeah, just 2 cups of chamomile tea with milk and honey, a couple slices of pizza, just have a chill evening. Hira says, hi, how do I stop getting distracted while studying for step 1? I don't know what that means. Like while you're actually in QBank, I've said do blocks of 10. Like I said that, because the phone is the big fucking thing, right? So this fucking phone, what you're going to do is you're going to take it and you're going to put it in your fucking backpack. And then your backpack is going to go, if you're at like a cafe, backpack's going to go across the table. If you're at home, backpack's got to go across the room. That's what you're going to do. Okay. So, you gotta get away from the phone and do blocks of 10. And then I've said that after you finish each block of 10, I want you to take a quick break. So I want you to go grab your phone. I want you to have a quick bite. I want you to have a quick drink, watch a YouTube clip of like something sports related or something, not med related. And then you're going to go back to the next block of 10. And that's how you're going to chop through QBank. I've made lots of clips on that, of course, but I get asked the same dumb questions because, if I mention how to do something, not everyone hears it. And then, or new people come into my space, right? And then we, get asked the same dumb questions regardless. So Sarwar says, hey, Dr. Mike, do you recommend doing final pass of first? This is exactly my point. Do you recommend doing final pass of first aid in the last 3 weeks with NBME, or is it redundant? It's laughable, right? Because like those of you who know right, if you've been in this chat already. Like I've already said, like you're going to be doing the NBMEs leading up to your exam. And I've said first aid at this point is essentially obsolete slash atavistic. It doesn't have a role in current USMLE prep. It really doesn't. It's an anachronistic resource. So it was obviously ideal for the numerical step one, right? It was ideal, but nothing against first aid. Just we have a pass fail step one now, so we're wasting time, the superfluousness of it. So you gotta do my PDFs. You're gonna do high yield arrows. That's what I want you doing, like in the final stretch. Like I said, 20 through 31 for step one. You're going to be doing 6 through 13 for 120, 2CK. But high yield arrows, you got to know that for step one. For 2CK, if your basics are very fucking weak, you want to know cardiopulmonary gastro is internal medicine for 2CK. And for step one, you also want to go through those PDFs. They're mixed PDFs. Don't worry about like is material. If you're studying for step one, you're like, but Michael, what do you mean? Those PDFs are also 2CK? Like, really? I don't want to study 2CK material. Well, don't fucking worry, because if you go through the PDFs, if something is specifically 2CK, I fucking label it. Okay. Like I have tables that are like surgery 2CK, like only. And you're like, cool, I can skip that table. So don't worry about that. But cardiopulmonary gastro, you got to know those subjects really well. And my heme PDF, you want to do that. Do all my PDFs. Let's see. Ahmed Eleman says, "Hey Mike, what is your opinion on the step one subreddit? I don't like get involved with that. There's a lot of cuck stuff on Reddit, obviously. When you're in my position, you have to balance between like having awareness as to, like you want to have community feedback. I'd say I mainly get that through our Telegram group. Like I can see like if people have concerns or questions, that's the benefit of generating your own community, right? Like what we're doing here. This is what we're fucking doing. This is called community management. Holy shit. So if you guys have questions or concerns, like, right, that's what we're doing right now. Reddit I see as very cuck. So, it's like I can be, maybe once every like month, I'll like check, what are people fucking saying about me on Reddit, which is always like 9 times out of 10 negative fucking shit, which is why like you can't get pulled into that. That's not like, it's a long fucking discussion. Those of you who've been in my live streams already, I've talked about this, that when you're growing in influence, you have to be able to handle people talking shit with big fucking mouths where you're not able to respond, and you got to be able to handle it. You can't get pulled into it, and just accept that that's not going to go away. People will continue talking shit. That's I don't get pulled into that. So Brown says, I'm 2.5 months. I already read that. You asked the same comment. Damien made the same comment. Damien Lewis says, what is your opinion on stuff like Picmonic, Pixarized, Sketchy, Laughable? Look, I mean, laughable in the sense that they're not integral to prep. They have no role. However, as insofar as you get through the tetrad I've talked about, like you get through your QBank questions in a given day, you're making inroads through my PDFs, you're making inroads through my YouTube MCQs, you're going to do the NBMEs at the end. Insofar as you knock out these components of the tetrad, I don't care if you want to, do other resources. Like that's not for me to decide, right? So if you want to like do Sketchy for Farm or Micro because you learn through like images, Pixarized, Picmonic, like if there's something that you particularly have an affinity for, I don't give a fuck. Just don't let it be where you're waking up and fucking doing Sketchy and like you're not getting through QBank questions. That's not acceptable. Okay. But if you do like 40 questions in the morning, you take the afternoon or lunch, and then in the afternoon, you get through like 10 pages of my cardio PDF, and then you're like ADHDing the fuck out. Maybe you watch like 3 of my YouTube MCQs, and you're just like, okay, you have dinner, and then knock yourself out, do fucking Sketchy. But as I just said, don't let it be where you're waking up and you're fucking doing like Pixarize, but you're not doing QBank. It's nonsense. I am Nada. NADH says, YouTube question bank is miraculous, Mike. Thanks for putting effort in making those. Well, thank you, Nada. Speedy Medical. Hey, Mike, what's the good score? What's a good score on NBME 9? Good is subjective for 2CK, right? Because obviously there's those of you who have different goals. So, I would say as long as you're passing, most of my students are just praying to pass. I'd say 80% of my students are fighting just to pass. I take a lot of the hard cases. I'm the equivalent of like the surgeon who like takes the patient who needs a quintuplet bypass. So I take the hard cases, a lot of them. And so, if I can get students from a really fucking shite place to their passing with a buffer, like that's what I'm fucking good at. And so like I like when you ask what's a good score for NBME 9, I mean, for a lot of my students, I'd say if they can break like 220 on that, where 214 is a pass, I see that as very good. There's those of you who want your 260, right? Or else you don't consider it good. Mustafa, you're a member of my channel. I really fucking appreciate it because you're green and everyone else is fucking gray. And you got my icon next to you. When one should expect micro Anki? Okay, fair question because I've talked about how I might make micro cards. I haven't done it just because I don't like give a fuck right now. Like I want to do it, trust me. I just have to. I am taking the spring and summer to do just like some other things, but um, I probably at some point will make a micro Anki. The other thing is Anki's not free, right? Like I can't put Anki cards out. My Anki cards on my site would not be free; they'd be paid. I'm not in a rush to make paid content. I prefer to make free content. You say, okay, Michael, then why don't you just make like a micro PDF or something? Because I do actually think the best way to retain micro would be through Anki, not PDF necessarily. But I've my high yield dermatology PDF is loaded with micro. Okay, so if you guys are itching for like a PDF relating to micro, high yield derm loaded with fucking micro. And also I have a virology PDF. Maybe you guys didn't know that. So it's in the assessments, not the free, not it's on the free stuff page. But when you scroll down through the PDFs and then below that, there's assessments, says free assessments. There's a virology PDF, so micro assessment one. That's all virology right there. But we have a pass fail step one now. So a lot of the nitpicky micro, a lot of that is it's borderline. Like back in the numerical step one era, yeah, a lot of nitpicky micro, sure, but now yeah, I haven't made that a priority. But I will probably at some point make micro cards. Chayo says, "Hello, Mike. I've gone through UWorld twice and FA 3 or 4 times. Did some of your PDFs and took one NBME, didn't pass it. Took UWSA one, passed it. I mean, you clearly haven't seen any of my fucking like clips or anything about guidance because like that's like literally the antithetical to like anything I've prescribed. So you did some of my PDFs. Well, you didn't fucking do all my PDFs, did you? You didn't do cardiopulmonary gastro. How do you know? Do you know high yield arrows well? Go through high yield arrows. You say, Mike, I went through high yield arrows. Fucking do it again. Go through high yield arrows again. Okay. Because sometimes a student will say that they went through high yield arrows. Ask them a basic question. I'll just be like, what are the arrows for like, you got high aldosterone, what are the arrows for sodium, potassium, pH, bicarb? And they like don't know. And like, it's the first fucking question of high yield arrows is literally, it's literally the first fucking question is what are the arrows for high aldosterone? The student doesn't know. I'm like, okay, well, go back to high yield arrows. That's how you're going to pass step one. Okay. UWSA, I've said, doesn't have a role unless you exhaust all the NBME content. You've taken one NBME, you didn't pass. So if you didn't pass, I mean, I'd have to know when you're sitting your USMLE. Do you have time constraints? Can you move the exam? Like, there's a lot we'd have to chat about. Ibrahim says, what specialty do you have? Like, what kind of doctor are you? I'm not a fucking cuck doctor. I teach USMLE. Rob M says, or I'm dyslexic. Rob B. Hey, Mike, planning step 2 in August. What should I do other than UWorld? You're going to do the CMS forms. So if your step 2 is in August and you're not moving it, then I would say you need to be right now just on the CMS forms. That's what you need to do. Then you're going to go and ultimately do NBMEs 6 through 8, then free 120, and then NBMEs 9 through 13. Dr. Huda Saad, how can I join your Telegram channel? If you go to my YouTube MCQs, the link is under the videos in the pinned comments and also on my website. Okay. If you go in the Telegram group, like I make posts through my Telegram channel, but in all of my videos in the description, I have links to the Telegram channel. If you're not asking about the group, you're asking about my channel. They're different. The channel is just a feed where I have just my posts. The group is like people's cuck comments in addition. Okay. My stuff can get lost in there. So if you want my channel, just my personal feed where I have my content updates, that link is under all my videos in the descriptions. Okay. I'm not asking you to leave the live chat, but just be mindful that if you want to join the channel, it's there. And those of you joining the live chat now, please give the video a like so that it kicks up the algorithm. Okay. It brings more people here. Juan Dugarte says, the big boss fire. Appreciate it, dude. Awesome. Salome says, for a non-American student, do I really need to do step one after my third year? It means it costs a bit. I would never recommend doing step one after third year. What do you mean? Do I really need to do step one after my third year? I would never recommend that. But unless you're talking about how like some of you have like 6-year, combined undergrad med programs, that's different. For most people have a 4-year program. They do step one after second year. I don't want you doing step one while you're on rotations, if at all possible. Warisha, because you're definitely going to sit step one prior to step two. Never take step two prior to step one. Warisha says, what to do if someone is bad at histology and radiology. My PDFs have important histo and radiology in them. Okay. I mean, like they do. So I have important slides, all the important radiology that's relevant, high yield for USMLE. It's in my PDFs. If something's not high yield, I don't have it in my PDFs. So that is how you can pick up that info. I don't want you like randomly studying like, some obscure histo book or some radiology text. I don't want you doing that. Demi3on T says, half a margarita and hyperventilating, LOL. It's true. So, well, for those of you who weren't here for my little anecdote before, like when I finished my P's rotation, I was in the Asian, my friends were all Asian when I was in like 4th year. And like, we went out for Korean food and also got some margaritas. And like one of the dudes in my group, he was Chinese actually. He got like the Asian flush. So he got like, he was all like red, like halfway through the margarita. And I was like, you're right, dude. He was like hyperventilating though. It was like, it was kind of cute because it's like, it's like half a margarita and he's like struggling and he was like, but he was like trying to like fit in, have margaritas. James Franklin says, stupid question. Exactly how similar are step one questions, NBME questions? They're the same. It's not a stupid question. It's important question because, you guys need to know that the NBME questions and the real USMLE are exactly the same. Okay. Cuban questions are not the real USMLE. And Alvaro Tavares says, currently reading your pulmonary PDF. Good. It's an excellent PDF. Raj Matthews says, I'm a year removed from preclinicals. How much time in months should I spend on step one? I've said like 3.5 months, 3 to 3.5 months for step one. You just got to go. All you got to do is knock out a QBank, Amboss or UWorld, knock one of the QBanks out, and then you're going to, I've talked about this repeatedly, right? So you're going to knock out one of the QBanks. You're going to knock out my YouTube MCQs with PDFs. You're going to do all the NBME exams 20 through 31. As long as you do that material, the NBMEs ultimately, and you get objective 205, 210 plus score equivalents. I've said that whatever your number of wrongs are on the NBME exams, you take that number of wrongs, you plug it into the score conversions that you get on Reddit. Okay, so you type in Google Images like NBME 23 score conversion Reddit. You get a graph, and then you plug the number of wrongs into the equation on the graph, and you get your 3-day score conversion. Internal pass mark 197. I want at least 3 exams that are 205, 210 plus. That's what I want to see. So as long as you do that, it's not about how much time. It's just you got to objectively get those scores. Raj Matthew, also thank you for sharing everything that you do. Just lost the fucking question. Chat moves on me sometimes. Let me see. I've said that sometimes when you guys post, it moves the fucking chat on me. Assam, I read that. Akia Brooks. Why do people do 2 passes through UWorld? I share your content with every med student at Ochsner, and many of them say that they are doing 2 passes through UWorld. Why? Well, the reason people are doing 2 passes through UWorld is because they're misguided, and UWorld has big branding. And, people like me, actually, I mean, I don't have enough influence at the moment to reach those people. That's why. It's hard to break big branding. It's the same thing with like FA, right? Like there's many of you who are cautious or perhaps apprehensive to not read FA because you have a couple decades of branding, where people have been very ingrained to engage in certain methods, even if they're obsolete at this point. So like, this notion of doing UWorld twice, it's like, it's an obsolete method. UWorld's too long as well, at this point. Okay, so when I did UWorld a decade ago, it was 2,150 questions. Now it's an absurd 3,700 for actually, yeah, 3,700 for step one, 4,100 for 2CK. The QBank's too long, so you got to do just UWorld once or Amboss once, and you're going to do NBMEs 20 to 31 and free 120. And as long as you do well on those assessments, you don't have to do UWorld a second time. If anything, and I've talked about this, if you guys like finish QBank, you do NBMEs 20 and 21, and your scores are poor. I'll talk about the specifics in a second, but if you have really shitty scores, then I can sometimes prescribe going back through UWorld incorrects, not the second pass of the QBank, just incorrects, okay? Which can be half the QBank or more if you're getting really shitty scores. Or instead of doing UWorld incorrect, sometimes I'll just have you go fresh into a new QBank like Amboss. The time and place. Some of you who've like been your prep's been dragged out for a long time, for like you've been going through UWorld for like a fucking year, you're not making progress. Sometimes I just say, no, we're going to like Amboss or something, start things fresh for you. If you come out of QBank though, and you do NBMEs 20 and 21, I want to see at least about 60-ish%. What I'll do is have students get the 3-digit score conversions. I want you getting between a 190 and a 196 generally on NBMEs 20 and 21, which are fails. Okay, so I'll like allow you to fail 20 and 21, but not that bad. If you get a 189 or lower, I say, nah, we're not proceeding with 22. So if either you do NBME 20, so either NBME 20 or 21, if you don't get at least a 190, I don't have you move forward. So you take NBME 20, you get a 189, I say, nah, you're not even doing Form 21. We're just going to go back to UWorld incorrects. We're going to do just Amboss now. Okay, new QBank. So I allow you to fail a little bit, like not that bad on 20 and 21, 190, 196. I say, okay, we'll move you to 22 now. You do NBME 22, now you have to pass. I don't allow the bar to be a fail anymore. So I'd say now you have to get at least a 197 on NBME 22. If you don't get a 197 on any of these exams going forward, I'm going to pull you out of the NBMEs. You're going to spend an entire month doing QBank. Now, if your exam's in like, 3 weeks or something, whatever it turns out to be, and you're like, I don't want to do that. I don't want to postpone for a whole month. Like, no way. Like, that's terrible. That's not a good idea, Michael. I don't want that. I say, okay, then don't fucking fail an NBME. Like, I don't know what to tell you. So like, I'm happy for you to fucking sit in like 2.5 weeks. Great. Cool. Sit. If you fail an NBME, I'm not allowing you. It's like discharge against medical advice, right? So you have an ACL repair and you're walking around feeling good after like 2.5 weeks or something. And like, you're a little bit sore. Doctor says, don't fucking use your knee for like 6 to 8 weeks. You're like, well, I still want to play football. And like, it's not a good idea. So I don't allow a fail on NBMEs 22 onward. If there's time constraints where your school is saying, fuck you, you have to sit, we can't change your exam date, then that's the only time I could occasionally have a student push through the NBMEs anyway. I don't like that situation, but like, obviously that happens quite a bit when a student comes to me and they say, I have to sit X date. That's it. I have to. I can't move my test, and they're not getting like good grades in the NBMEs. I still have them go nuclear through the NBMEs generally. And, even if the scores aren't where they need to be, but if you can't move your exam, what are you going to do? But Ochsner, yeah. I mean, I used to tutor the Ochsner students back in, it would have been like 2014 or something, at the PA hospital in Australia, and also at Ipswich. Ipswich was part of UQ at the time. My cohort had the students I was teaching at the time, they averaged like 240s on the numerical step one. The rest of the Ochsner cohort was getting like 210 or so, right? But I mean, it's me, so there you go. Giovanni says, hey fam, I've always had a problem with exam timing. Even in-house exams, I was always barely finishing on time. Should I still do UWorld Amboss untimed? Okay, fine. If you're really, and you said you're stressing, Okay. I mean, if you're really like stressing for time, like your pacing is like an issue for you, then you can do timed mode. Okay. But for most of you guys, I think timed mode is overrated. I don't think you need to do timed mode for the most part. But if you're really struggling, we could have you do timed mode if you're barely finishing on time. But macro retention, I think tutor mode is better. Suraj Karanje, how to study for. I just fucking. God, I clicked on the chat and it like moved on me. Let me see. Don't no. Just trying to find where I was. How to study for. So Suraj says how to study for ethics, biostats. For step 2, I have an ethics and communication PDF on my free stuff tab. So communication ethics PDF, it's there. Biostats have a biostats PDF. So, I mean, that's pretty self-explanatory, but also the Q-Bank questions you do, the NBMEs you do. So those are going to be biostats as you're going through. Know the NBME questions really well. You got to know the NBMEs really, really well. Champion. If you guys are new coming into the chat, please give the video a like so you can kick up the algorithm. It brings more people here. Thanks, I appreciate it. Champion, in a block of 40 questions, I'm getting consistently 32 to 35 correct. Is it good? Yes, it's fucking good. Okay, so I mean, you're talking like at least like high 70s. You know, that's like obviously good. So, you know, there's those of you here who would pray to get like 60% in your blocks, and meanwhile, Champion here is like, guys, I got like an 80% on my block. Am I doing okay? It's like, I mean, those types of questions like laughable. Jay Mother says, "Hello, sir. Just wanted to ask you if I am 2 months away from my exam. Would you recommend videos as in Boards and Beyond or do UWorld? And the thing is, if you aren't good at question solving, how should you proceed?" 2 months, Boards and Beyond has no fucking role in USMLE prep. That's another example of like some cuck question. But you know, it's nothing. It's not to like be derogatory. It's just that, as I already said, similar to my response with like students with like sketchy picmonic pixar eyes that I answered like 20 minutes ago, is that I have no problem with you like using some resource if insofar as you get through the tetrad. So insofar as you get through your questions in QBank, your 40 to 80 per day, and my PDFs, my YouTube MCQs, and ultimately the NBME exams later. You can do other resources. It's just those shouldn't be a salient focus. And you're not good at question solving. Well, guys, what do you think? If you're not good at question solving, how are you going to get better? You're going to do more questions. Okay, so you got to be agnostic and just move through the question banks. Not get emotional, not get tied down in your day-to-day micro fluctuations and scores. Okay, it's just practice. AMS says, "Hi, UK med student, and somehow like studying." You like studying for the USMLE. It is much more clinical than our current preclinical med exam stuff. Love your vids PDF. Do you suggest other resources for learning more clinical stuff? Well, you're going to do UWorld or Amboss for 2CK. That's how you're going to do. That's how you're going to learn your 2CK material, your clinical stuff. Okay, and my PDFs, my YouTube MCQs, and ultimately the NBME exams and the clinical master's series forms. If your question is more about like physical exam, are you talking about like, that's not USMLE. I'm not like here to coach on like what, physical exam textbooks like Talley and O'Connor or whatever you choose to use. I don't know if you guys use that over in the British, in the UK, but in Australia we use Talley and O'Connor. That was like the go-to physical exam textbook. Sebastian Hain, hi Dr. Mike, hi Dr. Mehlman. Just wondering if you have heard about any recent changes or focuses of step 1 in summer 2023. I have not. And even if there are like arbitrary changes in the exam, question pool updates. So you have that question sometimes like what's going on with question pool updates. Well, it doesn't change anything in terms of your study because nobody knows really. So like, even if let's say they add like safety science or they add like, it doesn't change anything. Everyone's in the same ballpark of uncertainty. So it cancels out amongst test takers. Yeah, so just like don't worry about that. Olumide, hello Mike. What's the best way to remember micro for step one? I've said my high yield derm PDF is loaded with micro, and also I've gotten a lot of micro on my uh, YouTube. So not just the YouTube MCQs. I don't know if you guys know this, but I actually have YouTube PowerPoints that are like 45-minute long. Okay, 45 minutes long for micro. Okay, so um, in the playlists, if you go, there's like a PowerPoints playlist. So lengthy micro PowerPoint presentations I did that can be helpful. Mashoud Faruqi says, "Hey Mike, any tips for sustaining performance and not burning out while prepping for 2CK? I'm 1 month out from my exam, and tired as fuck. Done with UWorld and CMS forms. Have you done 2 passes of the CMS forms? Would be my question. And you're gonna have to do NBME 6 through 13 and free 120. But if you're burning out, you can take a day off. I know that might sound like ludicrous if but a day off is okay to take. And also, like when I was back in the day, I was so gunner that the notion of taking a day off was like absurd to me. But like at the time, but now is like in a pedagogical role, I understand that taking days off is important. It's like going to the gym; you got to like have days off, right? So yeah, I would, and that as well, somewhat ironically, is like going to the gym daily can help with your psych, okay, and help you be of better performance, engage in better performance on your actual study. Ikra Mahamadi says, "Hello, Dr. Mike. 1 pass of UWorld for 2CK enough? I will go through CMS forms twice, your PDF and NVMe. Yeah, I said just do UWorld once. You're not going to do it twice. It would be like 8,200 questions. Like how ludicrous would that be if you're for just UWorld? No, you're going to do UWorld once. You're going to do the CMS. You're going to do so for 2CK. You finish all UWorld. You're going to do the CMS forms once. NVMe 6 through 8. Double pass all the CMS forms. Free 120. NVMe's 9 through 13 in that order. That's if you're linear as a post grad. If you're on rotations, obviously you're knocking things out subject specific. Nakia Brooks, you answered my question about where to find the NVMe conversion chart for other students. Thanks. Nahid Al-Sanozi says, "Hi, Dr. Mike. Thanks for everything you share." Thank you, Nahid. Manthan Patel says, "Is 1 month enough for step 2? Absolutely not. That's like a troll question right there. I've said 4 months for 2CK. Musa Batur says, "I plan to take my exam early September. I've done 31% of UWorld. My average is 41%. Thoughts?" Look, okay. So I've said that regardless of your scores in UWorld, you need to just push through. So if we're talking like, holy shit, 31%, so low, like OMG, what do we do? Okay, well, you're just going to continue through UWorld. You have to just do the questions. Like there doesn't need to be some external emergency maneuver we engage in. It's more just you have to just continue through UWorld, literally. Okay, it's literally what it is. So yeah, I want you to continue through the QBank. You're only you're 30. You said you only done 31%. You're 41% in terms of performance. It doesn't matter. They're both fucking low. So you're just gonna finish all the QBank, and then we'll do NBMEs 20 and 21 for step 1 after you're done, or for step 2 NBMEs 6 and 7 at least, and we'll see how you go on those NBMEs before deciding what we want to do as far as going back to incorrects or doing another QBank, okay, like Amboss at that point. But if you're overtly failing the NBMEs, like I'm sorry, you're not ready to continue through them. Manthan Patel, how would you prep for the exam in 1 month? You wouldn't. But it would if you're forced to, like if your school says we're going to kick you out if you don't take the step in a month, you're going to do all the NBME content. You're going to go nuclear. You're just going to go through all the NBME content. Guys, if you're coming in now, just please give the video a like. It'll kick up the algorithm, bring more people here. I really appreciate it. Ashud Faruqi says, "How to interpret CMS form results provided on the NBME website, which is points unrelated to number of corrects." Yeah, you're right. So it's obscure, like the way CMS forms do things, where they're 50 question forms, but they give you a score where 20 arbitrarily, it's not number of correct out of 50. Like they'll just give you a score of 20 and they'll say that's average, and they'll say standard deviation is 3. So let's say you take a 50 question CMS form online and you get like a 25, you'd be like, wow, I'm almost 2 standard deviations above for like IM or something. That's like a really good score, like a 25, right? Or like if a student says they got like an 18, I'm like, okay, well, you were below average, but not catastrophic, right? Like you were within one SD below the mean. Occasionally I get students who get like 12s, 13s, and I just know that they're nowhere near ready. That's what that means, right? So yeah, but I don't fuss over that scaling. Like I don't care what you get on the CMS forms, truthfully. I don't really care. That's why I just have you do them all of them offline. I don't care what you get on them per se. What I do care about is what you get on the full length NVMe exam. So let's say you get fucking like 15s, almost 2 standard deviations below on the CMS forms, where I said 20 was average, and then you do the NVMEs after, and they actually go pretty decently. Like that's what matters more. Okay, you'll improve a lot as you're doing the CMS forms. How many step questions for step 2 per day in your experience is appropriate? Assuming you want to do it ASAP to avoid burnout. I said 40 to 80 questions per day in QBank. For the CMS forms, you're going to do 2 forms per day maximum, which is 100 questions. And then only 1 NBME per day ever maximum when you're doing an NBME for the first time. Rejuvenate Simple. Thank you so much, Mike. Yazid Kamel says, hey, Dr. Mike, how's it going? Looking good, brother. Nisar Ahmed says, I heard UWorld covers 80% step 2 CK. Rest should be covered through AMBOSS. Is it true? No, that's not true. I don't know. That's like such a random fucking like misguided like piece of info. Like I don't really know what to say. Let's see. Force quit. I'm getting like a force quit. That's like no. I'm gonna close some applications right now. This is really fucking weird. I really hope it doesn't force me to quit. Like it's so fucking weird right now. I'm getting like a computer notification that's like, yeah, that's cool. That was like fucking weird. This is like a new Mac. Like, how is that? How am I getting? It's like your applications are like running out of like fucking memory. What the fuck is that about? Like, close some applications. I remember what I was talking about. Yeah. So your comment here was, I heard UWorld covers 80% step 2 CK. Rest should be covered through AMBOSS. Is it true? And I said it's a very fucking like random and specifically like misguided piece of information. It would be like somebody making a Reddit post saying like, Mehlman PDFs only cover 45% of what I'm supposed to know for USMLE. Is it true that I should therefore do like FA, the remaining? Like, it's a very fucking obscure and like highly specific, wrong fucking piece of information. Nahid Alfan Al Sanozi says, is it okay to study your PDF prior to UWorld for CK? I'm just closing other fucking tabs too. Like paranoid now. In case the live chat just fucking closed on me. Is it okay to study your PDF prior to UWorld for CK? I wouldn't do them prior. I would just do them with, like, alongside. I wouldn't. No, I would not do like a reading period, quote unquote. Okay, like some of you might ask, should I like read to like learn like an arbitrary amount, boost my knowledge base in an arbitrary amount to get enough foundation, and then at that point go into QBank? The answer is no. I just want you doing straight up questions. You got to move through, and you do my PDFs alongside questions, which I've said numerous times. So you do your 40 in the morning questions, take lunch, then your afternoon, evening. That's when you're going to do my PDFs, my YouTube MCQs in particular. Asana Asif says, can first-year medical students pass exam by reading your PDFs? And UWorld, yeah, that's how you would do first-year med. I mean, presumably, like you would go through questions, you go through my PDFs, you go through my YouTube MCQs. Absolutely, that is how you would pass first year. Mimi NK, but I wouldn't do any NBME exams. You're too far away from STAT. Mimi NKA says, hello, Dr. Mike. Just wanted to say thank you so much for what you do. You literally are godsend. I received my step 1 results on Wednesday and passed. Thank you. Your PDFs helped me so much. Well, thank you, Mimi. I'm happy you passed. And I just lost where I fucking was in the chat and moved on me again. Let's see. And Cheese Eggs says, should I memorize algorithms? No, you don't have to memorize algorithms. There's very, very, very few algorithms that you should like memorize for 2CK. And it's never like on purpose. It's more like there's certain things like renal injury is like an algorithm that I've just noted. Like I've never, it's not like you hear all the UWorld charts slash algorithms and you got to know them. It's not like that. It's more like I make observations across like NBME exams as to like what's ultra high yield slash what shows up repeatedly. And like renal injury, where if patient has bruising or pain over a flank, like let's say a hockey stick, patient's hit in the flank, okay, bruising or pain over the flank. The first thing you're going to do is there gross blood in the urine? If yes, you're going to do CT with contrast. Ultrasound is wrong. Sounds fucking wrong. So you say if there's like potential renal injury, why would you do contrast CT? Good fucking question. Okay, it's what the USMLE wants. So bruising or pain over the flank, you say is there gross blood in the urine? If yes, you do CT of contrast, CT contrast of the abdomen. If no, you're going to do urinalysis looking for microscopic blood. They ask that. And if the microscopic blood is positive, CT with contrast. If negative, no further diagnostic studies indicated. Okay, that's high. So urine, blood, hematuria, therefore highly sensitive for renal injury, meaning if it's negative, we can rule out. Now, that's nothing I've romanticized. Like, why would I give a fuck? It's not like there's no chart I memorized. I literally know that because I've seen it so many fucking times in USMLE questions on the NBME, and it was on my real deal as well. Okay, so that's an example. It's just if you go through the NBME content, then you're going to be able to pick out what the high yield patterns are. And that in turn is actually what guides what you need to know. I would just study like the NBME exams. I wouldn't fixate on like, UWorld algorithms. I've said you don't need to annotate. Okay. Tobena Onuabuchi says, I'm in med school finals. I'm grateful for you, man. Appreciate it. You are making the prep much better. Thanks, Tobena. Ahmed Mubashar, how do do your PDFs perfectly? I've said just do them alongside QBank. Okay, so I've said repeatedly, like when you do QBank in the morning, you take lunch, then the afternoon, evenings, that's when you're going to do my PDFs. If you're doing NBME exams already, then you're going to do all the NBME work during the day, and then the evenings is when you'll do my PDFs. No annotations, don't need to make Anki cards, nothing like that. Just read. And number of pages per day is going to differ for those of you. Like some of you can go through really fast. I have other students who go through very slowly, so that's going to differ. Frong says, Mike, what's the best way to retain info from your PDFs? I forget a lot of things by just reading through them. Literally the next question. I mean, I would say you should just read them. I don't want you spending time making Anki cards per se. It's more about progress. It's overrated, the notion of like needing to convert every little piece of information into like an Anki or something. Like that's overrated. So I would just read the PDFs, try to retain the best you can. And if you feel like you're forgetting things, just accept that that's normal and don't get pulled down emotionally over that. Amin Mubashar says, I think I forgot my corrects on UWorld. Should I do second round? I don't know what you're asking, but no, I would not do a second round of UWorld. I said that. I have 2 months out of exam at NBME. I didn't pass. I'd have to sit down with you and figure out what your exact situation is. I don't have enough specifics. Mustafa Muhammad says, why don't you recommend Pathoma, even though I can't meet my daily quota of questions? I've said that if you finish like the tetrad, then you can do other resources, like whether it's fucking, Pixarize, Picmonic, Sketchy, Pathoma. I don't really give a fuck. I don't want this to yet again become a Jeremiad where I, inject negativity into the conversation. Something against Pathoma. It's in my view that it's overrated. I mean, I don't really know what to say. Like it's the equivalent of it's the written resource equivalent of a YouTube clip that's mediocre that goes viral. Like, all the fucking clips I put out. I've never had a clip go viral, by the way. I've never, because my titles aren't clickbaity. But you get like one random fucking person in like India who like, makes a mediocre clip, like holding up FA, and they have like 29 videos and like, 90K subs, and it's like 200,000 views on like one video. It's like massively fucking cuck. But it's like, that's sort of what happened with Pathoma in my view, is it's like, for whatever fucking reason, it entered like a viral loop, and now everyone's like, oh my god, pathoma 1 through 3, 1 through 3, holy shit. And it's like, okay, like, I mean, I looked through it, I was like, what's the big deal here? Like, it's mediocre in my view. Not to be negative, but I'm trying to give you guys advice as to what I think is going to help you for the exams. Omer Khan says, been watching you for a while now. I appreciate how fucking real you are and how you've got a no bullshit personality. Appreciate the work you put in for us med students. Also, you're hilarious. Thanks, Omer. Golazo says, hey, Mike, just passed this week. Thanks for everything. I've been recommending your channel to all my friends taking steps. Thanks, Golazo. Nilam Rahate says, hi, how do you retain material on micro till I keep forgetting them? I mean, I'll make microcards later at some point. I've said my high yield derm PDF and is loaded with micro, high yield derm PDF, guys. And also PowerPoints on my YouTube. Okay, not just the micro MCQ playlist. Okay, of course there's that, but also micro PowerPoints. Holy shit, they're like 45 minutes. Okay, those are very good. Toby Salako says, step 1 in 5 days, high score on NBME 65%. Am I good? Look, at risk of setting you off, I would say that's not ideal. Okay. So if it's a situation, the reason I'm being cautious with how I'm articulating my response is because if you're not able to postpone, I don't want to set you off. If it's a situation, however, where you are able to postpone, that's ideal. Okay. So 65% is borderline. I don't like, why are we going to YOLO? It's infinitely worse to YOLO, fail step 1, than it is to just postpone, be inconvenienced, and score higher, get more of a buffer on your NBME exams than pass. Like, that's what we need. So 65% is a YOLO, like you're real fucking cutting it close borderline. I don't like that. I don't want that. So I want you scoring higher. Okay, I'd have to sit down with you and discuss like the specifics as to, how to develop your schedule out more if you can move your exam. Logic says, what is the best way to approach UWorld for step 1? I've set untimed tutor random mode, at least 40, 80 questions, never fewer than 40 questions per day, never more than 80 questions per day. And I want you doing blocks of 10. So 4 blocks of 10, okay, or 8 blocks of 10, ideally, if you're ADHDing out. Doing blocks of 10 is very fucking effective. Mohammed Algira says, can you give me your Telegram channel? I already fucking answered your question. Okay, I mean, the Telegram channel link, not the group link. Okay, they're different. Said the channel link is in the description of all my videos on the YouTube. Okay, so the link is there. The channel is just a personal feed of all my content, but the group itself, when I post something in the channel, it automatically will cross post into the group. So everyone in the group will see it, even if they're in the group. But if you're in the group and not in the channel, you'll see the post in the group. But then other people's cuck comments will come in and can overshadow. Like, I'll post something and someone asks some like dumb question immediately after, and it's like, cool. I just posted new content, but ask your dumb question anyway, right? And that's in the group. But my channel helps keep things organized where it's just my content. So some people prefer to just be in the channel. They don't want the conversation in the group. Other people want the group. So, I mean, the links are in my video descriptions. Damian Lewis says, can you do a premium Anki deck for pathology like you did for pathology? Can I do a premium Anki deck for pathology as I've done for biochemistry and pharmacology? Yeah, I could. I could do that. The thing is, like, I'm not in a rush to make paid content. Okay. I mean, that's really like, it's you get a lot of people, I've had people tell me, they're like, yo, you could fucking do like XYZ. Holy shit. I'm not in a rush to like, monetize bullshit, like stuff that way. So, I mean, yes, I will make more Anki cards at some point. I will do that. Yes, that's probably a future like endeavor in that regard. Yes. Kareem Maki says, hey, Dr. The Amboss USMLE Step 1 QBank is 2,734 questions, ? No fucking idea, right? I mean, is it? I thought it was like 3,300 I thought Amboss Step 1 was 3,300 questions. I'm just hallucinating that number. No. 3,300, I think, is actually Let me think. Yeah, maybe it's 3,300. I think step 2 is 3,700. I think those are the Amboss numbers. Obviously, I could be wrong. I don't know where you're getting 2734 from. That sounds like yet again another highly specific, like wrong fucking question. How's that? Not wrong fucking answer, wrong fucking question. Okay, so Aldil Aram Afsa says, should I start with QBank for step 1, even if my basics are extremely weak, or should I start with something else? No. I've said start with QBank. You don't need to start with like warm up reading. Like someone asked whether you should sit for like with my PDFs for a month as an example, gain foundation, and then start questions. No, I just want you doing QBank questions immediately, and you do my PDF simultaneous. Guys, if you're just joining, please give the live stream a like. That'll boost the algorithm, help get other people here. Saad Barkat says step 1 in 3 days? Question mark. What should I study? Well, high-yield arrows. Okay, so definitely do high-yield arrows PDF. Vince D says, why do you recommend a month and 4 days to go through the practice forms for step 1? Vince, it's because I have a very excellent way of getting people through. What I like is 2 days per NBME form. Then after the student does the NBMEs 20 through 24, I'll have them do 1 day on free 120 usually. And then I'll have 3 days where I have them do all those forms again back to back, 20 and 21 on one day, 22, 23 on another day, 24 free 120 the third day. No Anki across those 3 repeat days, but I'm going to have you do Anki for those initial days where you're doing 20 through 24 and free 120. So Anki on those days. No Anki on the 3 days where I repeat. You going through all the forms as though you've never done them. And then you're going to do 25 through 31, 2 days per form. And then after you finish all those, you're going to do 4 more days where you've got 25, 26, 27, 28, 29, 30, and 31 as an isolated day. And then will usually put in a biostats day. And then I put in like a buffer day, custom study day. And that's usually a month and 4 days out from the exam. That's an example. That's one example of how a final prep month could be. It differs for every student. Okay, so it's never cookie cutter, but that is a hypothetical example. I like people spending the entire final month-ish going through the NVMe content. That's how you're going to maximize your scores. This isn't fucking rocket science. Vince D says, why do you recommend a month? I just fucking read that. AMS says, whoever is imitating the emojis, you're a legend. Sabrina, I don't know what you're asking. Sabi says, bro, should I review whole NBMEs or just my wrongs? All of them. You're going to review everything, but you're only making Anki from your incorrects. Yeah, never skip. You have to hardcore memorize the NBME content. Jeremiah J. Whittington says, would you recommend doing the old and new CMS forms for CK? Okay. I read that as free 120 for a second. I am about 4 weeks out. You guys don't have to do the old free 120s, just the new free 120s. You say, why? I can't do the old free 120s. No, you can do the new. You can do the new and old if you want. Just there's copious NBME material. So, I'm starting with the fucking tangent first, right? But you can only do the new free 120, and I'm perfectly happy with that. You don't have to do the old ones. As far as CMS forms are concerned, yeah, you're going to do all the offline ones as well. There's only 3 questions I think that are actually outdated. Where I think only twice it's actually mattered. So there's one there's an outdated question where they're asking for C. diff treatment on an old internal medicine form. The answer was metronidazole, but the answer is clearly vancomycin now as of 2018. But vancomycin's fucking listed as another answer choice. You just say, well, that doesn't change anything. It's still there. You just choose vanco on this one. But there's one about latent versus active phase of stage 1 labor, where it's 6 is the new 4. It used to be 4 centimeters was the start of the active phase of stage 1, and now it's 6. And then there's another one where family medicine, it's a 32-year-old dude where the answer was lipid screening, but the new guidelines for lipid screening are 35 older for males, 45 older for females. So if you know those new guidelines, that's I'd say that those latter two, the two questions where it's fucking mattered. Apart from those, it doesn't matter. Okay. But if you knew the new lipid guidelines, you'd be confused. You'd be like, how can lipids be right though? It says it's a 32-year-old dude. Those are the only two questions where it's mattered going through the offline forms. But apart from those two questions, doesn't fucking matter. Bavaria says, by the way, I appreciate you joining my live streams because I've seen your name in here on all my live streams so far, I believe. So I appreciate you stopping in. I got to do some live streams at different time zones as well. I'm going to do like, because I know it's 5:25 a.m. for me. It's middle of like, I don't know, my early morning. I haven't slept yet. But I got to do some live streams for like the Middle Eastern time zones as well, because they'll be asleep right now. They'll just get like maybe shittier views. I'm not sure. But how about I read your question? Where, like, right? I just like went off without even reading your fucking question. Bahavi says, should I annotate FA with UWorld? That's such a cuck question. I just complimented you on being in my live streams. Now, how are you asking my FA at this point? I've like harped on that in like all my live streams. I've said like FA is not like integral. I did one block and it took me an entire day to annotate only 15 questions in FA. Like, that's such a cuck question, Bahavia. So, I mean, it's you don't have to annotate from QBank, period. Right? And if you're going to annotate, just use my fucking PDFs. Jenny Bush says, current rotation is internal medicine. Do I do all UWorld questions? All you will for internal medicine, those questions, then the PDF, then CMS forms, or does the order not matter? Just do it. You're going to do UWorld and the PDFs together. And then after you're done, you're going to do the CMS forms. The order does matter, Jenny, in terms of you're going to do the CMS forms after you finish all of QBank. You're going to do all 8 CMS forms for IM twice. Okay, so if you have a busy rotation, it'll take you 16 days. If you don't have a busy rotation, you do them on 8 days. Okay, 2 forms per day, just 8 times 2, but 8 days total for that. And of course, my YouTube MCQs, I have a massive fucking internal medicine playlist. Aziz says, we want the anime hair back. Ravinder Chauhan says, Mike, my basics are very weak and I want to score high. What should I do? It's so generic, you know. I said QBank, PDFs, YouTube MCQs. Moha Japan says, hi, Mike, I think we met in Osaka Station in 2021. Are you sure about that? I was picking up chicks. I must have been doing Nampa at the time. Moha, it must have been. You're a med student, huh? That's quite interesting. I've had that happen, actually. I've had that happen where people approach me in the station. I'll get approached by like a random dude from like a European country or something. I'll be like, I'm some dude from like Italy or France. It happens like once every like 3 months, maybe. I'll get approached by like a random dude who's like, I know you from like the internet. It's happened. It's happened. So I'm often distracted in the station, though. I'm not the most affable person, you know. So Mustafa Mukhtar says, thank you for all what you are doing. I am an old IMG, but no gap in practice. I will write step 1 in August. Any advice? If your step 1's in August, I would say from mid-July onward. So a month out from your exam, you got to start all the NBME content. And then up in between now and, you know, a month out from your exam in July, you're going to have to do QBank pretty much. That's what I would do in a vacuum without meeting you. But get through my PDFs, get through high yield arrows. E says, hey, Mike, I heard step 3 is heavy in biostats. You think your PDF is enough to be ready for it? I mean, it's a lot. PDF, biostats PDF, it's a good PDF. You know, you're going to do the NBME questions. So you're going to do a lot of biostats when you do UWorld for step 3 or Amboss for step 3. And you're going to do a lot of biostats when you redo the 2 CK NBME exams for step 3. So for step 3 prep, I've said that you guys are going to go through all of the CMS forms, the same as for 2 CK. I usually only have the students do them once if they're prepping for step 3. And then you're going to do all the 2 CK NBME exams. So if you're coming off step 2, you can curtail your step 3 prep by like a month plus, okay? Because If you just finished step 2, you just finished all the CMS and all the NBME forms for TCK. So you can just go straight into like UWorld for step 3, and also like the single NBME for step 3, the CCS cases. But if you take step 2 and then let's say, 2 years later, 3 years later, when you're in residency, you sit step 3 and you come to me and you say, how am I going to prep for step 3? I'll say, you remember all those fucking CMS forms you did like way back? I'll be like, well, you got to do those again. And you're also going to do all the 2CK NBMEs again. There's a lot of overlap. Okay. And weirdly enough, there's actually like some step 1 shit being asked on step 3. Step 3 is a 2-day exam. There's the feedback I've been getting. I'm not joking. This isn't a troll. Okay. I've literally had feedback where like students sat step 3, got like, what's the mechanism of action of aminoglycosides, like 30S ribosomal sodium inhibitor on like step fucking 3. Okay. That's like weird shit. Could be experimental. They want to see like, it's all speculative if it's experimental, but they want to see what people are forgetting. Okay. That's been posited. So Taha says, hi, Mike, should we do FA step 2? CK version? No. I talked about that on my prior live streams. He says, obviously, after going through your PDFs. I mean, you're right. Whether you put that latter part in there to keep me from getting triggered based on the cuck question, or whether, yes, you're going to go through my PDFs, but I've said that the CK version of FA is not a good book. And it's because everyone used their step 1 book for like 2 decades. So by default, people would just purchase the CK book and they were never incentivized to improve it. Right. So everyone bought it by default. So they had no reason to try to make it better. They had complacency. So Moha Japan says, will CK, but I did use FA for 2CK back a decade ago. And I made like flashcards from it. It was a waste of fucking time. Moha Japan says, will CK ever be pass fail? I don't know. If they did make it pass fail, like what objective measure would we have to admit people to residency, right? Like it's like saying would they ever make the MCAT pass fail, or would they ever make like the SATs pass fail, right? Like what objective, just go by grades, like bullshit fucking subjective grades where you're gonna fucking kiss ass to some piece of shit professor, right? Like that's nonsense. So I'm not gonna speculate. If they did make the CK pass fail, they would obviously be causing an extreme detriment to the medical system, because you learn shit when you're forced to study hard. That's how it works. That's how it fucking works. So it's nothing. I shouldn't say like for step 1, it's pass fail now. So you guys aren't shooting for your 270 on step 1, right? Like you just want to pass. But like, what's the result of that? Tell me what the result of that is. Okay, it means you don't know a lot of information that you would have learned had it been numerical still. So you say, well, I don't fucking know. Like I didn't realize aminoglycosides and tetracyclines were 30S, and that, macrolides, clindamycin, chloramphenicol, and isolate are 50S. Like I didn't know that. It's like, okay, cool. Well, if it's numerical step 1, you'd probably be incentivized to know that stuff, right? So, I don't really know what to say. Shadow says, hi, Mike. I am 1 week out from my step 1 exam, but I just scored 58% on the free 120. Should I postpone? You need to sit NBMEs. Okay. So you need to sit NBMEs. Otherwise, like free 120 alone is nothing I would want you to go by. But it's not high enough, 58%. 2/3 is what you really need. William, I'm an IMG, slow with UWorld, not doing any type of revision. I don't want to do NBMEs. I have a weak UWorld average, 50%. What to do for revision? I'm confused what you're asking me. You don't want to do NBMEs. If you don't sit the NBMEs prior to the USMLE, it's a bad fucking idea. Okay. It's insolent almost. It's audacious. Like it makes no sense. It would be like not doing QBank in preparation for the USMLE. Like you have to do all the NBME exams. I don't know if you're asking me like if you don't want to do an NBME at the moment to gauge where you're at. But if you're in the middle of QBank, William, you need to just finish QBank. not worry about your scores right now, and only do the NBMEs when you're done with QA. Jacob asks, hey Mike, which of your PDFs do you recommend glossing over the day or two before step one for some pass review? Thanks. High-yield arrows. Lost where I was, chat moved on me. Let me see. KKM says, I'm 70% through UWorld and step 2 is in 2 weeks. Should I finish UWorld or switch to not good? Your step 2 is in 2 weeks and you're 70% through UWorld. If you can't move your exam, you're severely fucking undercutting yourself, okay? And it's because you, in order to maximize your score on CK, you're going to finish all of UWorld. You're going to go through the CMS forms twice, okay? And NBME 6 through 13. So if you can't move your exam, you say, I am aware I didn't get through all that, Mike, but I can't move my exam. Well, I don't like that because you're getting like 20, you're going to get whatever you score on CK, you're going to get like 20 points plus lower, 20 to 30 points lower than what you could score had you just done everything. The CMS forms, all the NBMEs, 20 plus points lower. I don't like that. But that happens a lot actually, where a student will come to me and they can't move their exam. And I'm like, you know, you should be getting through more material. Hey, Melman, I have 3,000 QBank questions on UWorld left and only 1,500 questions on Amboss to save time. Or should I just do Amboss to set step one quicker or finish UWorld? I've said UWorld and Amboss are non-superior to each other. So you could just sit the 1,500. Fuck UWorld's 3,000 questions. They can go fuck themselves. Just finish the 1,500 in Amboss, sit NBME's 2021. If they go well, just move through 22 through 24, free 120, and then 25 to 31. Annie Max says, if you ever did residency, what specialty would you choose? Family medicine. I said that. I would do family medicine. I would choose family medicine in Hawaii or Alaska, but probably like Hawaii. Family medicine was my favorite rotation in med school by far. I did it in rural Australia. It's fucking amazing. But I like travel, you know? So like I wouldn't want like, I've talked about this. Okay. I want to keep the focus still on you guys right now. I could talk about me. But if it were literally a situation where someone's like, you know, you can go to like Harvard or something, I'd be like, nah. I'd be like, I want to go to like Hawaii. You know, I don't need that fucking like pampering type of like, when you're very young, when you're like early 20s, you're looking for all of that, like, you know, that prestige type of those external validators. And then over time, you don't need that the same way. Annie Max says, I just fucking read that. PJ finished UWorld and I got a 52% NBME on NBME 20. Should I continue NBME 21? Absolutely not. You're going to go back to PJ. You're not going to want to hear this, but you're going to go back to all your UWorld incorrects. So I'm assuming if you got a 52% NBME 20, maybe you have about 2,000 UWorld incorrects you got to deal with right now, or like 1,800 UWorld incorrects. You're going to go through all those incorrects for the next month, and then you're going to go to NBME 21. If you don't want to do that, you can, rather than doing UWorld incorrects, you can just switch over to Amboss. You're going to do all of Amboss, and I want you doing 80 questions per day. I want you going fast. You're going to go through all of fucking Amboss. Or I would actually sit down with you. Okay, I shouldn't say it so concretely 80. We could do 40 with Amboss and my PDFs. If you haven't done my PDFs, I would do 40 of Amboss and my PDFs and YouTube MCQs. Cardiopulmonary, renal, gastro, heme, high-yield arrows, a month of that, and then we can go back to NBME 21. If you guys are just joining, please give the live stream a like, and it will boost the algorithm, bring more people here. Amir Chehimi says, Dr. Mike, good evening. Right now I'm in my first round of prep for step 1. I do Anki every day, watch some Boards and Beyond, and read FA Pathoma and solid blocking URL. Is this a good approach? Highly cuck. I mean, like, right? If there's I don't really know what to say. Like if you've been following my content and you know my input at this point, like it's laughable because I get asked the same dumb questions, right? But like I've said that you're going to go through QBank, you're going to go through my PDFs, you're going to go through my YouTube MCQs, you're going to go through the NBME exams. There's nothing wrong with using external resources like Sketchy or, Pixarize or whatever the fuck you want to do, insofar as you get through like your QBank questions and my PDFs. Don't let it be some nonsense scenario where you are going to get to your exam, your NBMEs are not where you want them to be, and then I'm like, have you gone through my PDFs? And you're like, no. And I'm like, what have you been doing? And you're like, well, I've been going through like FA and like Pathoma. It's very fucking annoying. Okay. So like, the PDFs are there. Go through the PDFs. I have students where they'll send me incorrects from like their NBMEs, and I'm like, I can like literally locate where I fucking write that in my PDFs. Lamul Raber says, hey, Michael, what would you recommend for me being 2 weeks out for my exam? My second UWorld passed and last NBME at a 54%. No. I've gone through about 100 of your videos. Thank you. 1/3 high yield PDFs and 2 NBMEs. No. Your last NBME was 54%. If that was recent, you got to postpone. You're not ready to, your exam's in 2 weeks. In 2 weeks, your exam's in 2 weeks, you had a 54%. If you had a 64% on NBME, I would still have you postpone, probably. You have a 54%? You're nowhere near passing right now. You're nowhere near passing. So I'd want to know when you sat that NBME. If it was like 5 months ago, okay. But like, you got to go through NBMEs right now. I'd have you sit NBMEs. Like, I'd have you sit 25 maybe online because you're 2 weeks out, right? So I'd maybe have you sit 25. We'll see how 25 goes. If you already sat 25, if that's the 54%, have you sit 26? So I want to get the 3 to score conversions. You got to get at least like 2/3 plus. So you're a situation where I'd be postponing you at least like 1 to 2 months, and you'd be pissed off, and I'd be like, I don't know what to say, bro. Like, don't get shitty scores then, right? You're like upset with me because you're like, I don't want to postpone my exam. I'm like, all right, take another NBME tomorrow and do well, and then we don't have to postpone, right? Like, we're friends, we're on the same team here. So it's like, don't be upset with me that I'm telling you to postpone 2 months. Get a fucking 71% on your next NBME tomorrow, and then all of a sudden, like, cool, great, sit in 2 weeks. I'm happy for you to sit. You said you bumped up 10 points after starting my materials. Truth Teller says, I've heard you say 60% in UWorld is borderline passing. What's the percent for Amboss? Even though I don't care, like 60s in general is like what I look for in QBank. 60s in general, but I don't care what you're scoring in QBank. I said this. So if you're watching this right now and you're getting like 38% in UWorld and you're all depressed or something, I don't care what you're scoring in QBank, because the prescription is still you continuing through QBank, being persistent, not getting emotional about your micro fluctuations or your shitty scores, and going through my PDFs and my YouTube MCQs in the latter part of your day. The morning is your questions, 40. Take lunch. The afternoon, evening is going to be my PDFs, my YouTube MCQs, or you can go up to 80 questions. But I don't care. Like, I don't fixate on what you're scoring in QBank. When you finish QBank, we do the NBME exams, and that is going to determine whether we are going to change the trajectory of your prep. Okay, if you do really fucking shitty on 2020, I talked about this numerous fucking times, even in this live stream. So Ricky Coco, thoughts on taking step 2 before step 1? It's a bad fucking idea. Okay. Rotations happen during second year at my school, so people can choose to take either step 1 or 2 first. Bad fucking idea to take step 2 first. There's a reason why step 2 occurs after step 1. It's because your scores will be higher on step 2 if you take step 1 first. That's inevitably what it will be, because you're going to take step 2 and you're going to be like, I understand now why step 2 comes after. So the whole bulk of your application competitiveness is going to be your performance in 2CK. So why would you take step 2 first when you know that taking step 1 first is necessarily going to improve your numerical performance on 2CK? Makes no fucking sense to sit step 1 after 2CK. The notion that like you're more fresh or better at clinical stuff, or it's a bad fucking idea. Ikra Miriam says, can you please help me understand when to add inhaled corticosteroids and LAMA for asthma? Well, albuterol obviously first, right? So albuterol first, beta 2 agonist. Then the second thing is for outpatient. Then you're going to add a low dose ICS. Third thing you do, insufficient, make high dose ICS. Fourth thing, you add the long acting beta 2 agonist. LAMA, you said LAMA here. That isn't that, unless guidelines have been updated, I've never seen LAMA, a long acting muscarinic receptor antagonist, such as tiotropium. I haven't seen that for asthma. Unless new guidelines have shifted, I haven't seen that for NBME exam. Okay. But after the albuterol, low dose ICS, high dose ICS, we add the LABA. Maybe you meant LABA. Okay. Like salmeterol. It's a long fucking discussion. Obviously, my pulmonary PDF. Then you can add any number of miscellaneous agents like mast cell stabilizers, right? Netochromyl, cromolyn sodium, the leukotriene drugs like xylutons, eferlocast, montelukast. So there's drugs you can add, and then ultimately prednisone, last resort. Omalizumab, never fucking seen it assessed. I mean, what are we doing? Like a pulmonary session right now? But it's like for acute asthma, ICS has no role. You're going to give IV, so you do albuterol, and then IV methylprednisolone. Inhaled corticosteroid has no role for acute asthma attack. There is a 2CK question, though, where they want you to know that if a patient is hospitalized for an asthma attack, that when you discharge them, they automatically receive an ICS. It's like a slightly weird answer. I talk about it in my high-yield pulmonary PDF, but it's a weird answer because you say, wait, but they're not even like taking albuterol yet. But they like were hospitalized for asthma, and they're saying you just have to know that if a patient has to go to hospital for whatever reason for asthma, then they automatically get an inhaled ICS as part of their discharge management. Okay, so Mustafa says Muhammad. I mean, I must be cracked out. It's 5:47 a.m. So Mustafa Muhammad says, how should we read your PDFs? Like, should we just read? Yeah, I said just read. You don't have to annotate from my PDFs. Low Mail Raber. By the way, as a fellow content creator, thank you for giving away so much value to your audience. Much respect for that. Thank you, Lamel. Graciela. Root Solano. Mike, I love you. Saludos desde Guatemala. That's cool. From Guatemala. I'm trying to think if I dated a chick from Guatemala before. I don't know if I have, actually. That's like weird for me. Yeah, I don't think I have dated a chick from Guatemala before. Hashash says, love you, Mike. Hashash says, keep the good work, legend. Graciela. NBME 10 or 12 is more predictive. They're both equally predictive. Richard Hawan just signed in. Can you say the tetrad? QBank, PDFs, YouTube MCQs, the NBME assessments, including the CMS forms for 2CK. I don't want to go into like a 10-minute fucking discussion of the tetrad and like how to go through it and all that stuff. Like I've talked about that so many fucking times. I know some of you hop into the live stream late, right? And so you want me to talk about it, right? But there's those of you who get like, you don't want to hear the same dumb shit the same way I don't want to keep talking about the same dumb shit, right? So where do we strike that balance here? It's either you get salty because I'm not telling you in detail, in high level of specific detail, the tetrad and how to go through it. Either you get salty, or I have followers who fucking unsubscribe to my channel because they don't want me talking about the same dumb shit, right? Like, I mean, like, so someone's going to unsub. Someone's going to be salty. Ovi Sohail says, what is the best way to study for step 3? I've said that you're going to go through all the CK, all the CMS forms that you did for CK. Yes. All the TCK NBME 6 to 13, including CK free 120. Yep. And you're going to do, of course, UWorld or AMBOSS for step 3. You're going to do the CCS cases for step 3. And I like putting the step 3 test days if possible. It's a 2-day exam, by the way, if some of you don't know that. Step 3 is a 2-day exam. It's MCQs only on the first day. The second day is like half MCQs and all these like CCS cases that you have to do. But I like putting those days like 4 days apart because in between you can just do CCS review only. You'll do CCS case review throughout, even prior to the first day of the exam. But I like having that extra consolidation of like you just have 4 days doing nothing but CCS cases. Hipsto Proc-a-thon. You have good PDFs. Thank you, Hipsto Proc-a-thon. Kabir Bansal says NVMe 29, 70%, NVMe 28, 70%, NVMe 27, 72%. Date taken, 4th of July, 4-year exam. Should I postpone? No, those are good scores. Truth teller, is it possible to plateau at 65% or similar percentage for step 1? I've heard it's 90+% chance of pass. Why is that bad? I mean, there can be various reasons for plateauing in your scores, right? That's always possible. I'd have to diagnose like why you have a theoretical plateau. There's always ways to break through. Have you gone through my High Arrows PDF? Have you gone through my other PDFs, right? Have you gone through my YouTube MCQ playlist? Students like, no. I've done like a few questions. Like, have you gone through the PDFs? You're like, I looked at like some of them. I'm like, have you gone through like the, updated cardio, for instance? No. Okay, I don't have to fucking tell you then. Go through my PDFs. Khalid Hossein says, any video resources you recommend for Step 2 CK? Okay, well, you guessed it. My YouTube MCQs. Holy shit. I suck at algorithm questions like next best step. I usually can't be logic between answer choices. Well, I feel like it's a content gap. Rejuvenate simple. I like being in the channel, exclamation point, for Telegram. Your content is epic, exclamation point. Thank you, Rejuvenate Simple. Crazy fucking Arabic, I can't read. Is the real exam harder than UWorld NBME? I've already said the real exam is the same as the NBME. I would say the real exam and the NBMEs are easier than UWorld. I think UWorld plays gotcha a bit more than the NBME does. There's occasional obscure NBME left field questions, but I'd say UWorld plays gotcha with some twisted questions that are too specific. I lost my spot in the chat because I said, oh, here we are. I just found the highly fucking crazy Arabic name, and that's what guided me back to where I was in the chat. Mohammed Maher, what's the best way to master EKGs? Well, you're going to do my high yield cardio PDF because it's loaded with fucking ECGs. It's a good answer, isn't it? John McReynolds says, just took NVMe 31, 73%. Take step 1 next Saturday. Your content has been invaluable throughout my process. Thank you, John. 73% is good. I'd still want you taking other NBMEs, though, to confirm, right? We don't want to go off and isolate NBME. Pinnacle Adam, I'm currently stuck at work most of the time and unable to do my UWorld 40 to 60 questions per day. Advice, please. Exam in November, not done with first pass. There's no fucking excuses. You have to do 40 questions per day. Ahmed, Sawas, Najer, or work less, right? Studying for USMLE is supposed to be a full-time job. It's not supposed to be like, I understand. Look, it's not like a lack of empathy. Like, I occasionally have students that are like 40s, 50s. I've had like students occasionally where I we Skype in and they're like, late 50s. Okay. So, I understand people will have like a full-time job sometimes, or like they got kids they're taking care of or something. I understand there's variables. But you gotta recognize that studying for this exam is supposed to be a full-time job. Ahmed Sawas Najer. Hello, doctor. Need your advice. Step 1 exam on 31st of July. I still haven't read psych, MSK, repro, farm, biostats, ethics, ... Not even first pass. Should I postpone? Not necessarily. You got to sit the NBME exams, right? Like, I'm flattered if you go through all my PDFs and stuff, like, right? I've said do my content. I've harped on it. But like, if you It's your NBMEs ultimately that are going to guide whether you're ready to sit. So insofar as you like do well in the NBME, it's like, okay, just sit. Uh, David Aminoff says, I decided to take the first step. Is it possible to make it in 8 months from now? If yes, how do you suggest to use the time I have efficiently? Videos, questions. You're asking like you're asking how to prepare for step one being 8 months out right now. You're so fucking far out. You got to go through QBank. So I'd have to talk with you. Are you in like you just started second year? Like where are you in your prep? Right? If you just started second year, I mean, you got to be making inroads through QBank right now. That's what you're gonna do in second year. QBank, my PDFs, my YouTube MCQs. Drill that fucking content. Get a jump start on all that. Okay, while you're in MS1, MS2, get a jump start on all that. Don't touch any NBMEs yet. You're clearly not going to pass the NBMEs this far out, nor should you. If you could pass NBMEs this far, 8 months out from step one, that's a problem with NBMEs. That's a problem with the medical licensing system. Like they should be. There should be a threshold. You shouldn't be able to pass NBME 8 months out when you're in MS2. Golaza says, "Do you think you're the GOAT?" How do I answer that question, right? That could elicit an audacious answer. Emily Lux, Dr. Mike, I do all NBME and free 120, and my score is borderline to pass, and I don't have any assessments to test anymore. Do you think it's good to use NBME 18? Why not 19? Thank you. I'm assuming you did 19 then. Thank you so much for all your help. Yeah, I mean, I've said that you can use UWorld self-assessments if you've exhausted all the NBMEs. I don't routinely incorporate UWorld self-assessments into people's preps anymore. So if you've exhausted NBMEs 20 through 31, 3, 120, yes, you can go Emily, Lux. Thinking of like the Luxor in Vegas. Has anyone been to the Luxor in Vegas? If you've been to the Luxor in Vegas, like, why don't you let me know in the chat down below? I'd appreciate it. That would I don't know. I'd be happy to know if you've been to Luxor in Vegas. Okay. I've been to Luxor in Vegas. My grandparents used to live in Vegas, actually. Yeah, many years ago. I've been to Vegas like 20 times. So I bet you guys didn't know that. So why don't I answer your fucking question? How's that sound? Well, I did, didn't I? This is me just like talking now. It's 5:57 a.m. And on that note, I'm going to transition into non-medical questions. So if you guys have non-medical questions, start asking them in the chat down below. I'll do a little bit of I'll answer some more med questions. Don't worry. Don't get fucking salty. Okay. But if you have non-medical questions, you can ask them in the chat below. Some of you guys want me to talk about medicine forever. Okay. Mike, only talk about medicine. I only am here for your medicine. I don't want you to talk about anything but medicine forever. So some people are real fucking heated real fast if there's a multi-dimensional aspect to like someone's potential like views on life or anything. People are very like one-dimensional. Only talk to me about medicine forever, Michael. Khalid asks, if I took step one and passed, but it's been a while and I don't remember many things from it, would that impact my step 2 score? Yes. Your foundation's inevitably weaker now, but it's okay. Should I review any step 1 stuff for 2CK? Not really. I mean, you could look at my immuno. Yes, you could look at my immuno, the chart on immunodeficiencies. That's exceedingly high yield for step 2 pediatrics. Okay, so the immunodeficiencies, they ask as though they're step 1 questions on the 2CK exam. So the last fucking question of my 2CK was on Wiskott-Aldrich syndrome, and the answer was T cell. They gave like a 12-year-old boy who had like eczematoid skin lesions, thrombocytopenia, and immunodeficiency. You need to know that triad is Wiskott-Aldrich. So you had to know it was Wiskott-Aldrich, which isn't hard, but many people wouldn't know that. So you had to know that triad of thrombocytopenia, eczematoid skin lesions, immunodeficiency, that's Wiskott-Aldrich, X-linked recessive, by the way. And then you have to know that it's a T cell dysfunction. Okay. Some sources might say it's dual BT. It's not. It's T cell dysfunction. That was the answer. It's just T cell. That was the last question in my step 2 exam. And I remember it because it was like weird. You say, Michael, you remember your questions? Well, that's weird, isn't it? To show up on 2CK. That's why it's like peculiar, because it's like, there's overlap. I got a question wrong on hand washing on my step 2, but I got the Whisker Aldrich question right. I got a shitty score on 2CK. I only got a 260, but that was like a decade ago. That would be like getting a 270 today because the scores have inflated. It's a stupid fucking talking point, but I just mentioned it nevertheless, that it's probably like getting a 270 today. Tony Montana says, what do you think about Andrew Tate? Look, I mean, that's a highly polarizing question, isn't it? That's like saying, what do I think about like Biden or Trump? So by asking that question, giving an answer, it inevitably like is going to piss some people the fuck off, regardless of what you say. You don't have to like him. I just think that under no circumstances should people be canceled. People should not fear that anything they want to talk about should be canceled, even if you don't agree with what they say. I think people should have a voice. Dangerous fucking 2023, dangerous fucking place we're in terms of people being threatened, in terms of cancellation over like opinions they have. You can get on YouTube and literally talk about like, I said this on my last live stream. You could get on YouTube and like literally talk about like your views on like the Uyghurs and like Western China or like Russia invading Ukraine. Like you say, oh, well, maybe it's not bad or something. And like, okay, nothing's going to happen. But then you give like unconventional views on like male female dynamics. They're just opinions. And like, you should be canceled. Like, I don't think people should be canceled. I don't think he should have been canceled per se. I don't think that should have happened. I don't think that should have happened. I mean, I know he did like the whole like Hustler University. That's the whole like monetization thing. That was like some pyramid scheme. No, that wasn't okay. There should have been accountability for that. Okay, that doesn't mean someone should be canceled. Joshua says, yes, your thoughts on Tate. Look, I mean, people gravitate toward Tate because he's like actually a masculine figure, right? That's self-explanatory. It's a long discussion, as I already said. I mean, that's a polarizing topic. You want to ask me about like abortion or gun control, polarizing. I guess I've transitioned non-medical questions, right? Am I gonna transition back into fucking like let's talk about UWorld now? Let's see. Let me scroll out. Yeah, just transition to non-medical stuff. Let me see. Will AI replace doctors? Completely replace doctors? I don't think so. I think like a lot. I think it'll replace surgery. I think AI and robotics will replace surgery. I think there will be like remote surgery performed as well. I think that'll drastically improve healthcare. You won't need to. Actually, remote surgery where you have like 5G or 6G, where a doctor in fucking the UK can perform an open heart surgery on someone in Brazil, like live or something. That will occur, but I think ultimately just robotics will replace like all surgeons in the future. But I mean, there's always going to be a place for like person-to-person communication. People just want to talk to humans at the end of the day. So I don't think there will always be an interface for humans. Right? I mean, but yes, a lot of medicine, but a lot of fields in general will be replaced with artificial intelligence. But it's going to create new jobs. There's going to be like evolution as far as how humans integrate into that process. So, humans will do other things. Nick Rana. Also, your video of how adversity creates change really impacted me in a positive way. Also want to say thank you for everything. Well, yeah, I made a verse. That's true. It's an important video on adversity forces change in you. It's a long fucking discussion. I mean, I don't need to go down that route right now, but yes, adversity forces change in you. Yeah. Volsi asking about like PDFs in UWorld. Transition to non-medical questions. I've answered medical questions for an hour and 45 minutes, right? I've already said some of you get like real fucking upset. Talk about medicine forever, Michael. Greetings from Minnesota. Ahmed, you're in Minnesota? That's cool. Jelly Singh, Aishdedu. You love me. Thank you. Doku ni sunderu. Nihon ni sunderu? Osaka ni sunderu? Doku ni sunderu. Doko de Nihongo mananda. Nakia Brooks says, listen to the exam advice videos. They answer a lot. B Rabbit was here yesterday and here today, like the video. Thanks for everything. Kareem says, thank you, Dr. Mike. I was 240 for CK. John Shaves. Is beginning of MS2 too early too? John Shaves. I know I don't think I've answered a question from years before. I said I was transitioning to non-medical questions. No, but you asked about Cuck resources as well, didn't you? No, you're okay, John Shaves. No, I said start doing QBank in second year. Find Myself says, Mike, how do you balance dating and studying for step exams? It's kind of difficult to maintain both. I was totally different between my step 1 and my step 2 days. My step 1 days, I had like a very, very like, I was beta and like I had a stable girlfriend at the time. I was like 24. She was 18, I was 24, and she was like introduced to me through like my housemate, my Aussie housemate, his Thai girlfriend's like coworker. And I like lucked out with that situation. It was classic situation of like some beta fucking like cuck who's like too afraid to like say hi to a girl who somehow got with like some like girl above his league. Like that's like what happened when I was like, we were like totally different though. I had no interest in her personality wise, and I think that's what held it together. Like that's always what happened. That's literally what happened. I had no interest in her personality wise, and somehow, but all the guys were interested in her, and then that's like why we stay together. It's like she was like, I don't know why you don't like me, but she preferred that. That's what women fucking prefer. That's like the thing. Women prefer guys who like aren't into them. That'll set some people off right now. They'll be like, "That's not true, Michael. That's not true." It's true. I mean, women prefer guys that are like dismissive of them. Find Myself, and then my step 2 days. That was like I was already on the route where I was like meeting lots of people. I was in a different world for my step 2 days. I lost where I was. The chat here. Let me see. I'm not answering medical questions right now. I've already answered medical questions for like an hour and 45 minutes. Any tips for someone starting third year in terms of how to crush step 2? Drum boy, you're a little late to the chat here. Talked about that. Leticia Clemente, do you recommend any specific order to take the NBMEs? It's like rather than giving like I could give a productive response. I could say like, yes, Leticia, this is the specific order to do the NBMEs. Instead, I give like some fucking like sarcastic, snide remarks that like, and I don't answer the question in a productive form. It's like, okay, like, all right. So you're going to follow up with that then? Are you actually going to give a response, or I'm just going to leave it at that? 20 through 30, 20 through 24, then free 120, then 25 through 30. For step 2, 6 through 8, then free 120, then 9 to 13. Reen Sarai, RB Rena S. It's a long fucking name. Yes, you've been to the Luxor? Good. I'm happy you've been to the Luxor. I've been to the Luxor in Vegas. I said I've been to Vegas 20 times. Emily Lux. Thank you so much, Dr. Mike. Drumboy 2728, only a 260, LOL. It's true though. Like I only got a 260 on step 2, but I said it was a decade ago. So it would be akin to getting a 270 today, probably with the score inflation, because the average was like 10 points lower. You can say it's a dumb talking point, but like, I mean, it's like, it's notable, like, because as time moves on, I never would have thought that like a 262 on step 1 and 260 on step 2 would somehow be like okay scores. But it would be like getting a 272, 270 today, where you're like, okay, not the crazy highest scores, right? Like there's people who get like 279, 283. Holy shit. Like, yeah, there's people who get crazy scores, but like at the time they were like good scores. Stand and deliver. Thank you very much. Jelly Singh. What do I look for in an ideal partner? I've talked about this in my prior live streams actually. And I've said that like my answers are trolling. I'm very, very like traditional in terms of what I look for in women. I prefer women are like I don't see career as necessary for women. That's like, I mean, some people say, Mike, that's like misogynist. It's like I don't. I'm just saying what I find. These are opinions. It's nothing negative. Do a career, yes. Do medicine. Like I'm just saying, like I'm okay. I prefer a chick that like I don't meet her and she's like, I'm doing a PhD in photosynthesis. Like I'm not looking for that. Like I prefer a chick who works at a convenience store. Like I prefer like more simple type conversation. Like I don't like I don't like too heavy conversation really. I prefer just chick like drinks her bubble tea, like chick wants to like have like raise kids, cook, clean, like very like 1920s type stuff. Like that's kind of the female I look for. And in 2023 that's considered like misogynist. That's like it's not once again, it's just there's nothing wrong with like yeah, do career, do all this stuff. Like nothing wrong with that. Just I happen to look for like traditional things. Um but yeah, I mean, I prefer Asian chicks. I've said that as well. Jay Solo, controversial, but thoughts on anti-vaxxers. Um, I mean, I don't really care about that too much. Like, I got vaccinated triple, but I mean, what do I care about thoughts on anti-vaxxers? I didn't want to get vaccinated. Um, I think people should have the right to refuse that as adults. Like it's one thing in pediatrics, right? Where you're like, to enter public school, okay, there might be requirements. Like you got to have like MMR, stuff like that, like for the safe public health. And you say, well, doesn't that apply to adults? Like, shouldn't there be public health measures in place? Like, I personally think, you know, I didn't want to get the vaccine. I saw it as overblown. That was my view. It was more like opinion. It wasn't like based on, I didn't base my views on science. Okay. I'm not going to pretend like I'm fucking some expert on it. I just more or less thought, I don't think people should have to have this intervention. And the only reason I got vaccinated is because I do a lot of travel. And so, like, getting a vaccine passport, I was forced to, in order to travel internationally, it's like, I had to get a vaccine passport. So I was triple vaccinated. But I was never scared of COVID. I thought it was very like mousy and whiny. Um, there are Japanese who still wear fucking masks. Like people need to like stop being so fucking mousy, right? And like whiny. I fucking hate that shit. Um, Joy Rahab Kalo says, why are conservatives specifically under constant attack by media? Well, if we talk about like left versus right, like, yeah, that's going to get you instantaneously alienate 50% of people watching if you make like specific views like liberal versus conservative, etc. I already talked about in my last live streams. Like I said whom I voted for. Um, I said I voted for Obama. I voted for Hillary. I voted for Biden. And but my views have shifted. I could never fucking see myself voting for Trump. That's a total fucking whack. Uh, he's just like overtly dangerous and autocratic. Like I don't support that. I don't support that. But at the same time, I don't support certain things on the left. I don't support like feminism, which is blown out of control, which is like, you know, and that even got to fucking me, right? People hate on fucking me, right? So that guy, I think it's out of control. And I'm pro-life. So, people have views on abortion and stuff. I'm pro-life. And I think guns, I'm not a fan of guns. So I have a lot of views. I have some views on the left, some views on the right. But I said I voted for Obama, Hillary, and Biden. Um, you know, I don't think I know anyone who like voted for Hillary. I don't think I know anyone who voted for Hillary. But I liked Hillary. There's nothing wrong with Hillary. She was the most qualified candidate, I thought. Like, I mean, so people want to call me like a misogynist or something. Like, I fucking voted for Hillary. I voted for Biden. I voted for Obama. Like, I mean, Lynette says, would you recommend first aid if there was no pass fail? Well, I said back in the numerical day, um, step one was ideal, you know, because you needed to know like fucking which subunit of which fucking receptor. Like, I mean, that type of stuff mattered if you're trying to get a 280 on like step one. But first aid, now that we have a pass fail step one, superfluous. Something against first aid is just the exam, the nature of the exam has shifted. Reen Surrey, RB Rena S. If you can fly home, which state would you like to visit again to chillax? I mean, to actually, if I were to like move to the United States, like if I were to actually live there, I'd move to Hawaii for sure, or Alaska. Probably Hawaii first. Um, I obviously went to school in Boston. You know, grew up in New York, but like I wouldn't choose those states at this point. I wouldn't be happiest in those states. Um, but I prefer to be in Asia because I like Asian chicks. I've said that. Zach Brown. Zach Brown says, "What the fuck happened to your face?" And the reason I'm reading this question is because I've said that you know, you have to be able to handle criticism and hate. And that's value I can give to some of you guys as well. Um, you know, you got to be able to handle like people having big fucking mouths saying real fucking shit. You got to be able to handle that as you grow in influence as well. That's not going to go away. You got to be able to handle people fucking saying big fucking shit with their big fucking mouths. Zach Brown. Yeah, I'd see, we meet in person. We'd see if you have a big fucking mouth. Rio says, do you speak Japanese? I'm from Japan. I mean, I speak Japanese like a gaijin, right? Like street fluent. I mean, I'm not like native, clearly. My Japanese, I mean, I've been in Japan 7 years. My Japanese was better 5 years ago when I was actually finishing the immersion school. My Japanese was a lot better then because I could write kanji at that point in time. So I could write kanji. I like forgot all the kanji. It's like I've said this before, like, you know, you guys watching this, like, when's the last time you've literally picked up a fucking pencil or pen and written like a paragraph in English? Like, when's the last time any of us have done that? Right? You'd be like, this is weird. I'm writing a paragraph in English with a pencil right now. Like, I mean, right? Like high school. Like, when do we fucking do that? So, like, it's like that with Japanese. Like, I could write Japanese kanji, like, well, 5 years ago when I was finishing the immersion school. Now I like can't do that. I can text in Japanese. That's no problem. Obviously, I can read and, you know, to an extent. Forgotten a lot of like the kanji, you know, the common kanji I know, but like um, Zach Brown, what do you think of Andrew Tate? Two things. One, I fucking answered that question. And two, after your audacious fucking question a moment ago, you have some audacity. I'll just like address your fucking question. I'm just kidding, Zach Brown. You got a big fucking mouth. Jesse Bell. What should I study to increase my NBME score faster? Oh, you can do my PDS. Let's see. What material was used to make the ethics PDF? It was like NBME exams. I know it shows up in the NBME exams in terms of ethics. Christian sent when I made that PDF back in like 2021. Christian Senny, what's the best way to study farm? I have free farm modules on my website. So if you go into the free stuff tab, there's free farm modules. Let me see. I just lost where I was. Sometimes the chat moves. Hi, first time being on your live stream. Greetings from Nigeria. Hello, Tar Fidelia. Reen Surrey, have you seen Mount Fiji? I've been to Fiji. Mount Fiji? Well, but Fiji's fucking awesome. Jess Allison. I have a huge fucking crush on you. You've been studying, or I have been studying and watching your videos so much that I started to have dreams with you. Too bad I'm not Asian, right? Well, I'm open to chicks who are not Asian. I mean, I prefer Asian chicks, like I said that, but I mean, I don't really know what to say. Um, I gotta curtail the rest of that like thought, right? I mean, I could just go on like, what am I gonna say? Volchi, you ask a med question. Aldo, med question. No, Aldo, any plans to do more videos on your other channel or do Q&A there? I don't have immediate plans to like use my old channel. Um, but I get a lot of fucking negative judgment. That's for sure. I don't really. I'm okay. Like people have. I've said this like, and I'll continue to say this is that you got to be able to handle fucking criticism as you grow in influence. And like I'm not big, but like people who have influence, you have to be able to handle people with big fucking mouths talking a lot of fucking shit where you can't respond. That's what you got to be able to handle. You got to just own it. Um, I mean, people criticize me all the time, my views, my appearance. That's okay. You can criticize my fucking appearance, criticize my views. Like open your fucking mouth. That's what like open your fucking mouth. Yeah. Make Carson, love you. Well, you too, Ben Carson. Joshua, biphasic sleep versus long 8 hours. I'm more biphasic. I definitely am biphasic. I like sleep like 5, 6 hours, like not enough. And then I will take like a nap before I teach. That's like what I tend to do. After like I eat dinner, I'll take like a very quick nap. Otherwise, I'm a fucking crackhead if I try to teach. Cow from Serbia. You're in Kosovo. Christian Senny, favorite movie. Um, I said The Fifth Element. The Fifth Element, Pulp Fiction, and Born Identity. Those are my three favorite movies. I would say. I would say. Um, the Fifth Element's fucking awesome. It's a good fucking movie. It's like one of the most underrated movies. Oh, The Cable Guy too. The Cable Guy with Jim Carrey. That's a good fucking movie. That was a very underrated movie as well. The Cable Guy. That's a really good movie. Yusef, where can we learn more about you? Well, aren't I like talking right now, non-medical stuff? I already said some people get salty and want me to talk about medicine forever. Only talk about medicine. I was talking about medicine for an hour and 45 minutes. I mean, like, it's not like I started this live stream talking about me. Like, I literally answered the same dumb fucking medical questions for an hour and 45 minutes. Have I been to the Cherry Blossom Festival in Japan, the Sakura? Yeah, I mean, that's like an awesome time of year. End of March, very early April. That is an awesome time of year. You go to Osaka Joe, which is the castle. Um, yeah, that's like an awesome time of year. I went this year. I took pictures. I didn't post them to my Instagram though. I didn't post them to my Instagram because I happened to go with a female, and then there's females that follow my like IG, and then if I post that I was in like a location, then other females will know I was there, with it clearly not by myself. So that's actually like why I don't post a lot of things, right? Does that make sense? If there's like a guy you're seeing and then he like posts that he's at like a fucking Sakura and it's like, oh, were you there by yourself? So I just like every fucking time I post something, I get my head fucking chewed off by like multiple people. It's like a forever. Even watching this clip right now, there's people there's like women who watch my fucking clips and then chew my fucking head off with like, you said this, and I'm like, I just ignore it, or I'm like, okay, I don't care. Like, chew my fucking head off. Say more shit. Don't care. Never cared so little about anything my entire life. Edgardo Torres, Eduardo. I think I recognize your name from my IG live. Would you recommend Foreign Mail 1 or should I buy the latest book? Well, they're different. Foreign Mail 1, Foreign Mail 2, they're different books. Different skill level. Get both. Jean Paul, How to Deal with Breakup and Depression with Low Mood. Just study. Gym is good. Go to the gym daily. That's the most important thing for your psyche is going to the gym daily. Like even if things in your life are just like shit, anything going on, doesn't matter. If you go to the gym daily, you always fucking feel better, especially if you do cardio. You will always feel better after cardio. Always. Always. Deal with a breakup. I mean, I've talked about that. You know, if you're upset about some chick who broke up with you, like the number one way to get over it is to instantaneously go out and like approach other girls. That's how you're gonna get over it real fucking fast. Gene Paul. Um, you have to just like literally, girl breaks up with you. You say, all right. And then what are you gonna do? You go out to. I mean, if you're in like an urban area, it's easy. If you're in a fucking rural area, it's not. That's why it's better to live in an urban area. You just go out and you say, all right, it's going to open like 100, 200 women in a fucking station. And then, take a lot of rejection and that those many adversities make you strong. And then in addition, you're going to meet new people, pick up numbers. And then all of a sudden you don't give a fuck about this like one girl who like broke up with you. But if that's how you get over it real fucking fast. You got to just not give a fuck because you're meeting other people. That's what you're going to do. Joshua, PhD in photosynthesis, LOL. I said that though. Like, why would I want to date a girl who has a PhD? No interest. I'd rather date a girl who works at a convenience store. I know that sounds like a parody, but it's not. Bakery, like a tea place, convenience store. I'd rather have like simple conversation. Jolie, hi Mike, thanks for your time. I am a resident, failed step 3. We'll take it again soon. Would you please give me some suggestions? I like can't process med questions right now. Let me see. Sometimes when you guys post something, I lose where I am. Let's see. Very difficult to pronounce username here. JYO. Turamaya Jane. Do you not like facial hair? I prefer to be clean shaven. Yeah, I know some people, like some girls like their scruff, right? I mean, like I can grow scruff, sure, but like I don't like prefer to have facial hair. I prefer to be clean shaven. If I grow scruff, it's because I'm too fucking busy to shave. That's why I don't do it on purpose. Like I'm just too busy to shave. Shrikant says, in the US, you are a dead man with your traditional female view. I'm with you, though. I think that's like most places. I don't think that's not like limited to the United States. Like, there's no freedom of speech anymore with regard to like male female views. There's no freedom of speech anymore. Nothing. This is nothing about like equal rights. Like, of course, people should have equal rights. It's zero about that. It's just if you voice any opinion about like, like what you think that a male female dynamic should be or like a relationship should be, like there's no freedom of speech anymore. Bidishi Barman says, do you prefer studying Harrison or Davidson or other suggestions? Neither. Why didn't you pursue the traditional path of clinical medicine? No interest. I said I had no interest. Like in med school, it was mainly like I liked family medicine, but like I didn't. I just like ultimately preferred like studying information, learning information more than like actually. I prefer just learning information rather than practicing. In Iraq, if you talk to women about sex, they crucify you. Well, I guess don't talk to women about sex in Iraq, right? Wouldn't Trump be good for the economy? He knows economics. Um, well, I mean, he was in office for 4 years, right? Deep corporate tax cuts. I mean, it just depends on what your views are for like what's ideal for the economy. I mean, but he helped the rich, didn't he? Street. I'm not going to pretend like I'm an economics expert. I stay within my lane. Street Khan says first aid is and has always been garbage, a money trick. It was fine for the numerical step one. Muhammad says yeah, it's laughable. It was fine for the numerical step one. It's just it's not a numerical exam anymore, right? So like all my stuff is about like pass fail exam, telling you exactly what you need to know without wasting our time. Someone just gave a donation, a live chat or a super chat. I really appreciate it. I'll see who you are as I scroll down the chat. Um, but all my stuff's based on pass fail step one, right? Like not wasting our time. But what if the exam suddenly switches back to numerical in like 5 years or something, which it won't. But if it did, it'd be like, oh fuck, now I need to cater to all this bullshit. Like, which receptor do we bind to with this and that again? Andraj says, based on your voting history, Biden, Hillary, and Obama, is it safe to assume your beer of choice is Bud Light? That's hilarious. I don't even think they don't even sell Bud Light in Japan. I wouldn't buy it though. I've said I like tequila and I like Japanese rice wine, Nihonshu. Um, I was in Kinosaki. It's like a place, and it's like a 3-hour train ride north of here. It's like where all the hot springs, some really good hot springs are. I was there about a week ago, and they had some like actual like local beer, Japanese beer that was really fucking good. I got wasted in Kinosaki. I got wasted. I had like 2 bottles of Nihonshu, which is the Japanese rice wine, and I had some beers, and I had umeshu, which is plum wine. I know some people, some of my followers are like highly religious and like that's bad, Michael. You're not supposed to drink ever. Um, I didn't put out a YouTube clip that day, but then I put out 2 the next day. I've been putting out like 2 on some. I put out 2 today too, actually. Put out 2 MCQs like before I started this live stream. Aldil 24. What reaction you got from Cold Approach? Well, I've said most women are not going to be receptive to uh, some random dude they don't know saying hi to them. That's like normal. You have to understand that that's normal. That's not about you. That's normal. Um, like people will the debate about what fraction the exact numbers. I don't really give a fuck about the numbers. Okay, I'm not a noob. I'm not some like amateur fucking like you know dude who fixates on percentages. But like, just let's say that if you go out and open, like if you introduce yourself to 100 women, you could be looking for a beta fucking like you want to get married and like have a white picket fence and have a dog and like you're just genuinely looking for like a conversation. It's not about intentions. I'm talking about just the action of the male going out and introducing himself to like let's say 100 women. The vast majority are going to not be receptive to that conversation. That's normal. But yes, I get like all sorts of reactions. I can get women throwing up hands, running away. Like, I mean, it's normal. You'll have like 5 girls run away, and then the next girl will be like happily talk to you. So it's not about you. It's like um, Shrikant says Trump 2024. I couldn't vote for, I don't see myself voting for Trump. Like, I couldn't do that. Even if I don't overtly support like things on the left, I said yes, I voted for Biden, Hillary, and Obama. But like, even if I don't support things on the left necessarily, by the next election, I couldn't just like overtly like vote for an autocrat. You know, I don't know. I don't know. I'm not sure yet. We'll see what happens. So Joy says, in your opinion, does life begin in the womb? When does life? I believe life begins at conception. Um, I basically like. I think Ben Shapiro has really good videos on abortion. He nails the abortion argument really fucking well. I like life begins at conception, in my view. You know, that's my view. It's like life begins at conception. It's like I don't think life magically begins at like week 7. I think it's a human being, and um, after that conception occurs, it's in my view, it's murder. Fluffy girl, hey Mike, if you abort. Fluffy girl, hey Mike, I ADHD while reading your PDFs. How do I focus? Caffeine. Do you know what percentage you have? Do you know what percentage you need to know to pass Comlex? I don't know. I'm not sure about the exact percentage. I know 420 is what you need to pass Comlex. Um, Maybe 2/3. I'm not going to over speculate on the exact pass percentage for Comlex. I don't really want to answer med questions right now. More med questions. If you can go back and to the past and thank someone for something amazing that taught you to be a no nonsense coach, you go back to the past and thank someone for something amazing that taught you to be a no nonsense. What would you tell them? I'm confused by that question. Um, if I want to like coach someone to be, if I want to tell, I mean, I've said that like you have to be able to handle like rejection. That's a very important theme in life in general. You have to be able to handle people talking shit, and people not being interested, and like you have to handle that. Especially as a male, that's important. Toretto, yeah, more facial comments. What's with your face, bro? You got a big fucking mouth, Turtle. I'm okay addressing it though. You know, some people want to say, "Oh, just ignore comments like that." No, it's okay. I can because you got to be able to handle uh, criticism and hate. You got to handle that. If you want to grow in influence, you got to handle that. Reen Suri says, "Actually, I find your other channel motivation." Um, Oase, what channel or what to use for step 1? More med questions. Fluffy girl, your appearance is hot. Seriously. Well, thanks, Fluffy girl. Appreciate it. What's fluffy? But no, but this is actually an important point I can make right now, which is that I think zero about that. If someone says something quote unquote positive, sincere or not, I don't think anything about that. The same fucking way, I don't think anything if someone says something negative. You can't have your cake and eat it too. That's how it works. You can't have your cake and eat it too. If you give a fuck and get high in your own supply, if someone gives you some compliment and you think you're like, oh wow, this person said your appearance is hot, seriously, and you actually like take that to heart and you're like, good, I feel good about that. You can't have your cake and eat it too. It means that you take to heart and feel down if someone talks shit about your appearance. So it's about your how do you interpret things above and below baseline. I don't think anything of that. I react and think zero to that. But that in turn is also why I'm not affected when people talk shit with their big fucking mouths. Um, the the Funzi God, you're the best. Thank you for everything, the PDFs and tips, and breaking a lot of myths about studying for the steps. Volchi, please, Mike, answer my exams in 2 weeks. I thought I like answered your questions already. In what order should I do the practice test? I answered that. M Zane, hold on. I see the $10 super chat there. Thanks, M Zane. Really appreciate it. But I like skipped over some questions. A lot of fucking questions, huh? It's a great power nap. Love Born Identity. Want to go back to Goa. Born Identity is a fucking awesome movie. Quadruple 2. How do you get in and out of the airport with those guns? That's funny. I don't have a favorite scene from JoJo. Jay Solo. It's more just like I just like the characters in JoJo. I never like hardcore watched JoJo. I just said that like if I had to choose an anime that I like, it's JoJo that I first watched when I came to Japan. I watched a little bit of it, but I'm not a fucking like wannabe otaku. Like there's gaijin, there's foreigners who come to Japan who are fucking wannabe. Um, they're wannabes. Like they try to watch like anime all the time. They try to like engage in. There's nothing wrong with like being interested in culture, but some people like sometimes I meet foreigners and I'm just like, you kind of just know. It's only something you'll understand if you live here, but it's like there's kind of like some foreigners that like they're over the top with it. Tamim says, "Why are you living in Japan?" I said I like Asian chicks. Natig says, uh, Natik says, "Why do you live? Are you a man or a woman?" I'm a man. I'm 100% straight. Uh, why do you live? Why do any of us live, Natig? Great IG strategy. I do the same. That's funny. Trill McKenzie. How old are you? 36. So I'm 36. Find myself asks, not a trolling question. Any tips on how to boost testosterone and libido? Go to the gym and lift heavy weights, and you got to eat a lot of meat. And you can't be afraid of saturated fat. I'm not saying like eat unhealthy. I'm not saying go fucking eat McDonald's. No, 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 no. I'm saying like if you have a steak and there's like a little bit of fat on it, you can eat that, okay? Or like, um, yeah, you can be like if you have like pork or something. I know many of you religious, whatever, don't eat pork. It's fine. Just but if you have like meat as a dude, don't be afraid of like some fat on the meat. Like you know that's how you build fucking like you know apparently saturated fat has like a role with like testosterone levels. So if you eat like only carrots, only lettuce or something, then maybe you're vegan. Well, there you go. Mohammed, I love how prominent is your zygomatic processes. Bidisha Barman, you are wonderful. Who gives a fuck to trollers? LOL. They're just jealous. Love you from India. I need to I need to have my Indian food quota. Those of you who actually like follow me, you've heard me talk about Indian food like a lot. It's my favorite food, Indian food, spicy Indian food. Palak paneer, spicy palak paneer. Papadum, spicy papadum with chutney or chutney. Um, Jean Paul, your thoughts on modern American chicks? Well, I don't live in America. I haven't lived in America since I was almost 23. So that's like, yeah, it's been a long fucking time. Basically 13 and a half years, right? Since I lived in Australia for 7 years, lived in Japan 7 years. So my thoughts on modern American chicks, I mean, what's my thought on them? Um, they're louder than most Asians, that's for sure, right? Americans stand out in Japan. Like I hear a fucking American accent from like a mile away. Matthew McHale asking me some med questions, Matthew. Um, what's the best sake in Japan? Um, Fuyuyama. There's like, I'll tell you, when I did my IG lives, um, there's some vending machines outside, just neighborhood fucking sake. It's not like one brand. I tried different sakes. It's not one brand, but if I drink sake like Nihonshu, the rice wine, right? Sake means alcohol in Japan, but Westerners think sake refers to the Japanese rice wine, which is actually called Nihonshu. So Nihonshu, the Japanese rice wines, because sake could mean beer, sake could mean just like tequila, right? But Nihonshu is Japanese rice wine. Um, but I try different Nihonshus. Like if I have Nihonshu on its own, like I have a bottle of sweet Nihonshu in my fridge. But if I go out to have like a meal with like yakitori, which is like the skewers of chicken and stuff in Japan, I like dry nihonshu, karai nihonshu. Sweet nihonshu is amai. Paul Stevenson, yeah, and M Zane, thanks again for the $10 super chat. Really appreciate it. I almost like skipped over it. It's a big fucking yellow rectangle, and somehow like I almost just skipped over it. I appreciate it, M Zane. Paul Stevenson, you're a dental student. You ask a highly like technical med questions. So happy watching you live. What are your maxillae named? My maxillae. Well, the maxilla is the middle bone in your face. Maxilla is here. Thank you for your existence. You're such a great teacher. I hope for your continued success. Thank you, Ducks Gene. Mugul 900 says they are kicking my stray kittens out unless the kittens do so by themselves. Ducks Gene. What made you want to move to Japan? Will it do your current career direction? I talked about this stuff. I said I visited Japan for 3 days when I was in fourth year med, and I wanted to move here. Instantly, I knew. I was just like, done. We're moving. Well, I moved. And that I didn't have interest in actually practicing med, and I was tutoring while I was in med school, and then that is what like continued. That's what happened. I started teaching more and more while I was in med school already, and I had like I didn't have Mehlmanmedical at the time, but I had word of mouth. I always had word of mouth, like private clients, like since med school, and I was teaching, and I was like, well, I can just continue doing this, and I did. That's like a long discussion, though. I mean, Carlos says, congrats on the 16,000 subs. Well, thank you guys. Thank you guys, actually. You know, appreciate it. McGabe says, love seeing you live. KG, can I buy Bitcoin now or not? I wouldn't buy right now. I'm not buying right now. I think prices are going to collapse. Prices are going to collapse. Then we buy. Not now. I'm not going to speculate as to how low it can go. Maybe 9 to 13. But I think it's going to collapse. I hope it collapses. You know, because I want to buy more. I shouldn't talk too much about money. There's certain things I shouldn't like talk about overtly. But I'm gonna wait. I'm not buying more Bitcoin yet. I'm waiting until I think prices will collapse. When do I usually do live streams? Asked Robinhood. Well, clearly fucking now. It's almost 7 a.m. here in Japan, so I gotta sleep. My sleep schedule is like so royally fucked up. Yeah, I mean, I could just like talk, right? I've been fucking talking, but I did an hour and 45 minutes of med questions. So I mean, you know, I've chatted with you guys non-med for a while, right? That's like we've chatted. So, but just in principle, like I gotta fucking sleep. Like it's 6:48 a.m. Like what the fuck, right? Like, dude, like I have to fucking sleep. So, shower, shave. I'm gonna have some protein. I'll have some more protein. Asun says, I love your I watch your neuroanatomy file. It's very helpful from Pakistan. Thanks, Asan. All right, so guys, thanks for tuning into the live stream. I really appreciate it. Obviously, I'm going to make more live streams. You know, it's not the last one here. So I'll see you guys later, all right?